Okay, now you're ready.
Ready for the pledge or what? Another minute.
Oh, I'm fine.
Okay. Let's have the pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Let the roll call show all is present, and we do have a quorum. Because one of our, Gary, Dr. Idlecheck is not here, he had an emergency, but he's en route. So he may not get here till near 7 o'clock. So let's move on down to B. Let's talk the 3/4 cent MOA.
Sorry. Okay. Before I leading into that, just so the council, I know you're aware, Mayor, but so through APCAG, the RACIC committee was formed a couple months ago with the I guess you can call it goal or direction to evaluate the ambulance service throughout Fremont County, develop potential models and research those for presentation to move forward with the ambulance service. This is also publicly available. If anyone wants to read it, I can provide copies. It's pretty comprehensive, but we evaluated through data and polling and other methods to develop different models and look at the models and the costs. Obviously, 52% come from the area code around Riverton, not necessarily Riverton itself, but just the 82501 area code. About 25% from the Lander area, roughly 8% from Ethity, Fort Washakie, Arapahoe areas. And then the rest of it is in rural areas of the county, Shoshoni, Du Bois, Jeffrey City, and the like. So the model that was reviewed, we looked at contracting out with a private company. We looked at contracting out with a regionalization from another provider in Wyoming coming in and providing services, as well as directly having local control. And so the model that actually was recommended was, we called it Model 2A. Lots of acronyms and it gets confusing, but basically it is a fully paid for model of, instead of 5 ambulances that's currently being operated, it would expand to 8 full-time ambulances, 2 of which would be transfer trucks, as well as available for 911 access calls. And then it would also provide volunteer services like we have here in Shoshone throughout the county, and like Jeffrey City, Crowheart, Kinnear, obviously in Shoshone. But the difference is that would all fall under one umbrella. So you have the training, you have all the other apparatus of the overarching umbrella there. And that's what was presented to FCAG. FCAG agreed on it. It was also presented to the county commissioners, who also went with that option as their intention. And they passed a motion to move to a joint powers board for overall local control of an ambulance. So it wouldn't be just from the county. So how's this tie into everything else that I'm about to say? I had personally, and I think the council also agreed, that we had 2 really preconditions with what was going on with the ambulance service and the tax proposal and things. One is we had no control. And then 2, giving monies to the status quo that we had no control, no say so, and no seat at the table was kind of the red lines where we had the issues we had. So through this process, we actually went out to Fort Washakie and met with the joint tribal business council and and I'm going to say it's historic, because after that meeting, both the unanimous consent of the joint tribal board or business council agreed to submit a resolution with their intention requesting to join FCAG. That, as far as I'm aware, has never happened in Fremont County. I know it's been talked about, but it's never happened. So that's how important this ambulance is, not just to us, but the whole county and the tribes as well. And having a seat at the table, I think, is the biggest thing. Having a joint powers board where you have some say so, you have some direction as a body. So that brings us back to the 3/4 cent tax. And that was something that, when it was presented to us, basically was an agreement that we were going to send monies of a certain proportion from this tax to certain entities that we not necessarily agreed or disagreed with, but we got no benefit from here in Shoshoni. And we had no control over how that money was utilized. We were just, write us a check, give us the money, and that's pretty much how it was presented. I think pretty much a consensus of that. So that has changed dramatically. So what we're looking at is not a status quo. We're looking at a fundamental change of how ambulance services is administered in Fremont County and returned to local control, but not just local control from one entity, local control through a joint powers board. In this case, FCAG is what the proposal is here. But not just that, that for Shoshoni, instead of keeping all the money, because it was for the ambulance mainly, but this agreement here would provide 100% of whatever proceeds that we do receive from this tax to ambulance, to FCAG specifically, not the county, FCAG, and only for operation of the ambulance service. And so the Shoshoni ambulance would basically meld into that overall system, and we'd be part of that, and we would have the access, the funds to be able to pay us. So we're not doing it alone. All the administration, all the training, all the other things that we currently have to facilitate on the side, we'd be part of a larger system, but we would have local control over how that is done here in Shoshone as part of that. So it brings all that together. So it takes a large burden off us, but actually we get, I'd say, more bang for the buck than what we'd be sending. But everything that we receive in Shoshone from this tax would go to the ambulance through FCAG, not through the county, where it would be, however, we would have no control. That, I mean, I'm trying to sum it up here for you as best I can. So there's two parts of this. The one is also a resolution for FCAG. But on this line item, it's specifically for the 3/4 cent optional sales tax MOA with FCAG for 100% ambulance and administration of the ambulance service through FCAG. So it's not through the county, it's strictly through FCAG. And joining together all of the municipalities. Riverton has also supported this on Tuesday or Wednesday. I can't remember, last week.
It was Tuesday.
Okay.
It was Tuesday.
I don't know what day it is anymore. On Tuesday. So they were the first to support it from RASIC. And so now we're coming back to Shoshone for the same thing. And so 3/4 cent tax, I can read it. You have a copy of it, but in a nutshell, you can let me know what you want me to do.
I just like to say this is what we were working towards, and to get it out of a for profit, out of state business that's running this, and get it under a government entity oversight that actually answers to the people. It's a consumption, that's a tax. The other way the county was looking at funding was gonna tax some mills, which they can do without bringing that to the people. They can just do it.
So that was one of the considerations that the county commissioners looked at, was creating an EMS district. But the way it was written by the legislatures, they can do that without any voter consent, but that would automatically apply a 2 mil levy on the entire district without any consent of the voters, any say-so of the voters. They can go higher than that with consent of voters, but just forming it
Right.
as an automatic 2 mil levy. So that is where the joint powers board comes in. This doesn't obligate us for any financial at this point in time. However, one of the things I'll note on the or on our work in the RACIX committee that was accepted throughout the state, as well as Cody Regional, who looked at it as well and agreed on the process, the data, and the numbers. There's currently a $3.5 million gap in funding versus the cost of an ambulance service. County is paying $1.8 million, but they also own all the assets. What's not included in their calculation is depreciation, replacement, and everything else of all the assets. That's monitors that cost $80,000, an ambulance rig that can cost upwards of $400,000, all the facilities. So when you add up all that, currently the county is essentially supporting the ambulance service to the tune of over $3 million for 5 ambulances. We'd have no idea, no transparency. We have no idea how much money the for-profit makes. We have no idea of any of that, and they will not provide that. And they're only providing 5 ambulances and a part-time transfer truck, which means you get flown out. You break your arm, they can't treat you here, they fly you out. You don't need to be flown out, but they don't have another option. This option essentially is slightly more expensive as a gap. When I say more expensive, we're paying our EMS workers $16 an hour. We're paying our paramedics $21 an hour. And we're losing them as fast as we can keep them. When you lose a paramedic, you lose an EMT, you lose all their experience, their knowledge, everything has gone out the window. They are so short-staffed, and you have burnout. You have EMTs that are working more shifts, and eventually that comes to a point where they just quit. They leave. This is serious. And when I say that, I cannot emphasize this enough. I have never been against this tax personally. I can't speak for anyone else. I was against the way it was formed. But here's the problem. We spend so much time disagreeing on how it was formed. I wish it was this. I wish it was that. It's not. This is what it is. If this tax does not pass, what is going to happen to the EMS? We don't know, but we know it's not going to get better. And it's very critically that people look at it from that perspective. And that's why all the work I've done in the last 3 months with the RACIC committee and all the time, the meetings and everything has been for this one purpose, one goal that I think we all agreed on the onset, is that having a for-profit company running it with no transparency, no oversight was not sustainable. And no one's going to support paying for that for a tax. What we propose and what has been accepted is local control, local governance, transparency, everything that has been stated as the problems with this. But in Shoshoni's case, we have the option of not sending any money from this tax to things that we get no benefit from directly. Ambulance, we do. And that's what 100% of this would go for. Du Bois is in the same situation as is Pavilion. And if this tax fails, I don't know. I don't know what's going to happen. I know Shoshoni can't take over the whole county. We have a property tax that is dwindling. It's going down, and legislatures, as they pass laws, it's great for us, or we all want to pay less taxes, but we don't want to consider what the scenario is where the money's going to come from to pay for the services we do have. And, I hear all the time, especially here, well, you spend money, cut the budget, find the savings, pay for it. I've said it before, I'll show you the budget. You tell me where we cut. I'm not going to say that government doesn't waste money, because it does, but we all waste money. But when you're talking on the tune of $6.5 million for a full ambulance service, that is something that you can't just find the cuts on some staplers and some whatever else you want to pick and choose from. There's not enough resources. It's a finite resource. Road and bridge. Why do I pay for road and bridge? They don't pave my roads. It's a finite resource. There's a lot of roads. Could they do things more efficiently? Perhaps. But that's for another story. But it ties into this because that's how serious this is that not everyone directly uses the ambulance. Some people just drive themselves. But what happens on that one time when you can't drive yourself? You don't know when that's going to happen. I didn't know when it was going to happen to me. It did, so it can happen to anybody anytime. And that's why I think ambulance service unilaterally, 94% of people in this county that took the poll agreed that ambulance service is not just a critical need, it is a essential service on the same line as police, fire. But by state statute, it's not. So there's nothing that says that any entity in this county is compelled to have one. I'm not saying that they don't believe that, but there's nothing that forces it. There's no funding mechanism directly tied to it. And that's what this tax is about. And I just want to point that out to the council that I know that there's a lot of issues with the airport on some people's minds, as well as the transportation that we don't receive benefit for. And that's part of the issue. But the overwhelming majority of this for the whole county is going towards ambulance, but from Shoshone, it's 100%. Our ambulance that we have here won't go away. It'll actually be emboldened. It'll actually be better. We'll have more resources through this. This is a process that's going to take time, but this is the first step. And all we're stating is our intentions of what we would like to see, and that this also calls for a yearly revision. If we decide that at some point something else, whether it be ground transportation or airport, is necessity or needed, or it help the senior center, we can change this. But this is not going to the county as it was in the original rendition. It's going to FCAG specifically for ambulance.
This has been a real move for the county commissioners too, to move to where we're at, because you've been preaching this quite a while too.
4 years.
Yeah. I mean, it's something we started working on a long time ago.
But it's not just us. It's Du Bois, it's Shoshone, it's Pavilion, and the tribes. And I think they get lost in the conversation. And I think that through this race at committee and the seriousness of it, we gain their support. Not only that they asking them or wanting them or needing them to be at the table, they agree to be at the table.
But honestly, the Shoshone starting its own ambulance service and getting that going woke people up.
It did. There's also a second point of this. There's the rural transformation funding grant that closes. It opened July 1st. It closes August 1st. But it's very specific on regionalization. There's some eligibility requirements. One is 2 or more ground ambulances in a district combined into one overarching one. The funny thing with that is, the county does not have a business license. They don't own an ambulance. They contracted it out. They no longer have one. So your question is, where do you get 2 in in Fremont County? Well, Shoshone's 1, and the dissolution of the current contract, Fremont, would be 2. And we've also melded with the fire districts, which is another component we can group with through Ron Wimpin, and through his support, we also collaborate through with fire district as well. And the last one's critical access hospitals. We don't have any in Fremont County. We have too many hospitals too close together, so they don't qualify. So the access, that grant money, this is the first step, and the second step that would actually allow FCAG essentially to purchase the assets that's owned by the county and own them under FCAG. And that's how this becomes an FCAG joint powers run service, where you have every community in Fremont County, the elected leaders serves on that commission, and they all have a voice for their communities on that, on how things are being done, which is night and day from how things are currently. Plus, you also have an expansion of services. So you have a return of volunteers that are working on these other areas that has gone away in the last 15 years to 5 ambulances. That's what this would be providing for. That's where this would be going if this ballot measure were to pass.
We got some questions for Chris?
I do. You said that we could. I have a handful of them where we could evaluate the senior center ground transportation, but on therefore be it resolved on number 4, parties 100% of the proceeds from Shoshone would go to FCAG for emergency medical services. But then it also says that the effective date is whenever the tax goes into effect, and the term is until the tax is defeated. So I don't see whether that would allow us to redesign the district, you do understand what I'm saying? We can't change the distribution for the duration of the tax.
No, so there is the other language where maybe the copy I sent you didn't have that.
That's
This-
the only one I got.
Yeah, sorry. This one has the clause that was added by Lander actually that we incorporated into this one. So this is different than the Lander Riverton. This is Shoshoni only.
Right.
There's a clause in here that states that every year this is subject to review.
And so basically this MOA, it's like Shoshone has their own MOA with FCAG, Lander has their own with FCAG, so that they can control the percentages of distribution. Am I picking that up right?
Yep.
Yes.
And then there was also plenty about the tribes and all, and then there's that resolution, which I'm sure we're gonna get to, but is the MOA contingent on the resolution?
No, they're separate, but they run parallel, not congruent.
So if the resolution 26 whatever if the tribe deal does not work out, then our funds, if we join the MOA, would still go, if the tax passes and we join the MOA, then the funds will still go through FCAG, because we got like an 18% vote there or something?
Yeah.
I mean, we do have say, a fair share of our say, actually a population disproportionately large say.
I would agree with that.
I mean, per citizen, we have more say than Lander, Riverton and all that. and that's
Someone's
great.
got to run the ambulance service and,
No, I think
and-
it's great.
right now county runs it and we tried to get an ambulance here and that's why we have our own because it failed. So to go back to what you were saying,
I'm
Yes.
just clarifying some of the,
yeah, so in this MOA right now, 100% is going to the ambulance. Talking with the senior center and their plans, that's why it was that way. We could always change that if they decide they want to
in 1 year. we
Yes.
review.
Yep.
If the tax passes.
if the tax passes, yeah. If it doesn't pass, it's null and void, doesn't really matter.
But that's a great idea where every different municipality gets to determine what's most important.
I think that That- I
What
think-
needs the funds the most.
And I think the other approach where it was being forced down everyone's throat to be the same as what Riverton Lander or just Riverton wanted, or whatever you want to call it. What one entity wanted that was bigger was saying everyone had to do the same. And I think that was the biggest problem here. Number one. Number two, at the time, the status quo was a for-profit ambulance that you're asking people to pay a tax for and give money towards when you have no transparency, you have no vote, you have no direction, you have no say-so, and you quite honestly get no benefit from. I think that was a kind of a tough sell to ask anybody, any municipality outside of that. So this is where things have changed with that. The status quo has changed. And because of that is why we are here now.
Anybody else? Yes.
So, in there, it said that the amount of money that Shoshone would give would be based on our population.
Mhm.
Which population?
Unfortunately, the census, not the actual. So by the time if this ballot initiative were to go forward, for 4 years, we would have the same the whole time. It wouldn't change. It's approximately going to be right around 60,000. It depends on how much is received in sales tax. So that does fluctuate. So, but from historical, amounts we received on the half-cent tax that we had, a little bit more than that on 3/4. So we're looking about 65,000 towards an ambulance per year.
So 431 or whatever, that's on the sign up there.
471.
Sorry, I shortchanged it.
So it's based on city limit population?
Yeah.
Or is it based on Shoshone address, like out in the valley and stuff, Shoshone address?
Just incorporated census data. I can tell you our population right now is about 592, but give or take, any given month.
What about the new hospital? Is there any funding or any help for ambulance services or anything with the new hospital?
So
Or they aren't having to fly them out all the time?
To address the hospital goes, there's also another mechanism where you can have a hospital ran ambulance service. The problem we have here currently is we have 3 hospitals, 2 of which are located within a certain distance of each other. And so if one hospital runs that, then it's not a for-profit hospital, it's a district. So you have a district that's competing with private within a certain distance. So that doesn't work. They can't do it currently. So there's no way to get, now Sage West theoretically could form their own ambulance. They could do whatever they want. But that's not in their interest to do that because it's a losing proposition. 911 calls are not a moneymaker. They actually lose money.
Unless you drive a wrecker.
However, this plan, and I want to stay on topic, but this plan actually, the transfer trucks is the key. So transfers has not just the person's paying, but the hospital's paying. When you do an inter-facility transfer, you're getting guaranteed revenue streams that's far and above what you get from a 911 call, guaranteed from the hospital, plus you're getting the payer. So for example, intra-facility transfers going from Sage West Lander to Sage West Breverton, which is what the majority of our transfers, about 1,600 a year, are. The hospital's paying us, it's very small. But transferring to Casper is the bigger transfers, and that's the ones that we're talking about. So as we gain more and more market share by having a robust, and also I want to point out, former dean here, not of this service, but the CWC has a new EMS training program for basic, advanced, all the way up to paramedic, and they're actually part of this committee. And we actually have that incorporated in this plan where we're going to train our own local people to be providers. And it's actually free. They have, I can't remember, he might, Councilman Norney might know the name of it, but there's a program that the federal funding monies pay for that service or that training. So it's at no cost to the person to receive EMT training all the way up to paramedic level. And they can do that here locally through CWC in partnership. So that is also incorporated within this plan to be able to staff these ambulances. Because we can have the ambulances, but if we don't have the providers, it doesn't do any good. And right now we're down to under 30 providers for the whole county. We should be about 48.
And how does air transport work into that?
So air transportation is generally, since we have time, we're waiting anyway. Air transportation, when I was a brand new deputy, it was called Lifeline. And it meant I go to a call and someone has in a critical incident, they broke their ribs, their heart has tamponade, they're going to die. That was a Lifeline. Anything else is ground transportation. It has evolved massively into Wyoming, where it is being utilized for all these rural communities to be able to take people to a hospital for care that don't need to be taken there because there's no other assets to do it. There's no ground transportation. So, for example, I give a personal example. So when my appendix burst and I went in for surgery in Thermopolis, and during the surgery, they shoved a trocar through my bladder, and they found out 24 hours later, they were going to lifeline me to Casper because they couldn't fix that. Actually, the doctor said he could. He's never done it before, but he'll do it on the phone with the urologist who will talk him through the surgery. And that was the same one that did that. I said, not a chance. No. But that was a lifeline. But they don't tell the patient that you have the choice. And so I asked, do I have to go by helicopter? Am I going to die? Is this critical? No, it's not critical. That's just what we do. I'll take the ground transportation. I'll wait because I'm not going to have surgery right away anyway. So that's an example of how Lifeline has been incorporated into pretty much everything as the answer because it's a lack of. So I had to wait 3 hours for a ground ambulance to pick me up and transfer me. And, but it was 2:00 in the morning. So it was fine, but it wasn't critical. But right now, if you get into a wreck, you don't have that option. You go in there for, you might say you're an AFib with RVR. I'd say it's serious. You need to get to an elevated care. That's what Dr. Idlecheck could probably talk to now when he's here. But you need to go to Casper. You might need to go to a cath lab. You might need those things. But you need to be transported by helicopter. Is that something that needs to? Well, right now, yes, you're going to go by helicopter because we don't have the capability to do ground. Because with that, there's still certain things that have to be done, medications that need to be administered that on that transport that we don't have the capability to do currently. And that's why so many people are being life-flighted out of Wyoming or out of Fremont County because of the lack of providers that can do the things on ground transportation where it's most appropriate. And oftentimes you'll get there before the helicopter gets there anyway, because how long it takes for them to fly there, get you loaded up, all that stuff. By then you're already almost in Casper by ground. So
Is that usually covered for the state?
Please, could could you please come identify yourselves? Sorry, then everybody can hear and, yeah,
So to answer your question, it's up to the insurance company. And some insurance companies will pay for it, some won't. They have what's called Balance Plus, where they'll charge you $70,000 for the flight. Your insurance company says we'll pay $2,000, and you're out of network with that. You're on the hook for $68,000, which is why a lot of people buy life flight insurance in Wyoming.
Yes.
But just because you have the insurance, there's also risk with flight. I mean, you are every time you get in a helicopter that's defying physics to some extent, you are taking a risk doing this.
And the weather.
And having flown in military helicopters, I can tell you, it is one of the scariest things I've ever experienced in my life. But you're right. There's also times that helicopters can't fly because of the weather. And so if there's you're sitting here and you're not being able to get to the higher level of care because helicopters the only way. So that's another thing that this leads into is this degradation of our ambulance coverage in Fremont County has massive effects on other things other than just number of ambulances in communities and wait times and all these other things. It also affects the patient directly on their level of care, their outcomes. All these different things are affected in various ways throughout the community because of a service that is, quite frankly, is underfunded. But through doing these transports, over time, as those become more that market share, treated like a business in that sense, that market share captured by ground ambulance here in Fremont County actually decreases that funding gap. And that's how a ambulance service can be self-sustaining in Wyoming in the rural climate that we find ourselves in. And that's the goal. The idea of this, one of the things that was looked at was being self-sustaining. That was in our mandate to be self-sustaining. One of the things that was looked at in this is after 4 years, that the ambulance service under government local control would be self-sustaining to the point that it does not need a subsidy or taxpayer intervention like this going forward. And that's why it's important to have that robust training apparatus, the providers, and all the things that are needed to be able to facilitate those types of transports in this case.
I'm Valerie Bates and I'm a retired RN, so.
Okay,
well, I appreciate your input, Valerie, and thank you so much.
Should knew from the scrubs.
So the air- What's the, would air transport, would the helicopters come from Casper? Where would the air transport?
We have 2 base stations here as well as 3 fixed wings here in Fremont County, which is crazy. They have that much resources for air, but that's because the market's so big.
Thank you.
Any other, Mark or
Yeah, so
Jordan had a chance to talk.
did you,
Was you waving your hand?
He's
Okay,
fine.
go ahead.
I'll go after him.
Okay, good enough.
will this also help to get wages up for these folks?
And so that's the other thing too, is I guess I skipped over that. So part of this is taking the wages to a level that is commensurate with the area. When I say the area, I'm talking larger multi-states on regional. But it's also a living wage. Making $16 an hour when you can make 18, 20 bucks at Walmart, 16 bucks working at Wendy's. I mean, why would you want to be a medic making 16 bucks an hour, putting up with what you have to deal with on a daily basis? And you can't even support your family.
Right.
It's not worth it. You know, some people do it anyway, but it's hard and it's not right. So yes, this does address the wage issue and it does bring them up to regional wages, $21 an hour for a basic with some experience over time with $21 an hour, and then up to a paramedic, around 30, which I still think is underpaid, but we're going with what's the regional rates are, but also what is at least, and that'd be a massive pay raise, for what they're currently making.
Councilman Whitener.
I don't have a question. I just have some feedback because I met with the senior center probably about a month and a half ago regarding public transportation. And they have no desire to be involved in public transportation. They are selling their bus. And the legalities do not allow them to get on the bus or help a senior citizen that maybe has a cane or struggling. And so they have zero desire for the transportation side of things. So it would make sense that it all supports our ambulance in
But if
that
it's-
situation.
If things were to change down the road and this were to pass, we could still address that at a later date. If they came and said, hey, now we want to do it. Council could still address
Ricky mentioned that it was due to insurance. They can't help anybody get on or off the bus. And so basically, if you step off the bus, they can't help you in your house, can't help you carry anything. All they can do is have a driver that pulls up and
wait for you to get there.
waits for you to go. I don't know. I just know what I was told when I met with the two of them. The bus may already be sold. I don't know. But it was about a month ago and they said that the bus would probably be headed back to where they purchased it from.
Councilwoman Harkey. You have any comments?
No, I'm just. Think they'd be able to figure something out, but insurance is terrible with stuff like that. I think the ambulance is a great thing.
Well, things have changed. It wasn't before, but
Right.
I think we finally have moved the needle to something that is much needed in Fremont County.
Councilman Stedler, have anything else you would like to address?
Seems like all our concerns were, all our issues with the MOA they presented before have been repaired on this one.
Yes.
Jennifer Shano. I don't know if this really has to do with anything, but I know since living in Shoshone for 17, 18 plus years, way back, we actually had first responders in Shoshone with the ambulance and whatnot. And I think there's 3 still in Fremont County within Life Site and here. How can we help them and implement them so it's not always a burnout on our police departments, our EMS? I know they can't do as much, but I know they do a lot of trainings and I know a few that would be willing to help.
And that's where this is big, because that apparatus will provide additional training for them to be able to serve and assist as a volunteer, that just like a volunteer firefighter. To be able to get the training they need and not have to pay the money, because that's some of the expense too, is right now the volunteers historically, and I might add that volunteers in this are actually paid volunteers. So they're not just volunteers for free. Firefighters are in a sense paid or compensated through their retirement. They get a retirement contribution for being with volunteers. Police department, or the old model was you just volunteered, you paid the money, you did all your CEs, you did all your training, that was all paid for by you, just so you could volunteer, because you had volunteerism, altruism. Altruism is not really a thing anymore, if it ever was. But people's time is a very precious commodity in today's world, and to have some kind of compensation is vital, because it is an expense. You do have to go to these trainings. You do have to take time off work. You do have to pay for these classes, the books, the materials, all these different things. So this is actually a paid volunteer system where they actually are compensated for their time as well. But they also have access to the training through CWC and then the overall umbrella apparatus that this would provide for the continuing education, to provide that framework and that on-call type mentality where, you get a call and then you're kind of like a fire department response now. Same thing here in Shoshone, where it's not just put on just 1 or 2 people.
Thank you.
Yeah, Chief, they would get paid per call, correct?
Yeah. We'll say compensated.
Yeah, compensated, correct.
Valerie again. Wondering about our lifeline capabilities where you can push a button.
So that is something that is kind of off a little bit. That's not really interrelated with this. So that is something that is a third-party contract, generally speaking, that is direct linked to dispatch, who then would contact the ambulance to respond. So in a way, it's not a direct link, but it would trigger that response here locally of a volunteer to respond to a life flight alert, as well as the police department as well. We respond anyway to those as well.
Okay.
I don't know if that exactly answers your question, but
So do people get lifelines here or?
We got a couple, and we've had a couple that sometimes didn't know how to operate it, and they would push it numerous times by mistake, and then they wouldn't know they pushed it, and then we would respond to check on them and make sure they're okay. And they're like, "Oh yeah, sorry, I pushed the darn thing." But yeah, that does currently link through dispatch. But in this case, it would provide a faster response of medical response as well as first responder of some kind, whether it's police department or fire.
Could the programs at CWC and volunteers go out and help people get them set up? I used to do area agency on aging in Michigan, and that was part of what we would do is we'd go out and help them get set up with that and understand it.
I think the best venue of that would be through the senior center and
Yeah.
creating a joint, program with maybe the town to promote something like that and provide that service.
Okay.
I think it's something that would be good to help do. But I think
Okay.
that'd be the best local venue to do that.
Okay, cool.
And anybody else from the floor? Do we have anybody online that's,
Dave. He doesn't have his hand up or anything, so I don't know if he has a question.
any more questions from any of the council? Can I have a motion to approve the 3/4 cent?
Move that we approve the memorandum of agreement between the governing bodies of the town of Shoshone and Fremont County Association of Governments as presented.
Have a motion on the floor, Councilman Stetler, can I have a second?
I'll second.
Second by Councilman Nordine. Any further discussion? None being, all in favor, say aye. Aye. Opposed, the same. Motion passed, all in the affirmative. Move down to C, resolution 26-0010, joint powers FCAG ambulance.
I'll read the title and then I'll discuss the language of it since it's 8 pages. Resolution number 2026-0010, a resolution authorizing the conveyance of oversight of the emergency medical services to the Fremont County Association of Governments Joint Powers Board, contingent upon the admission of the Eastern Shoshone and Northern Arapaho tribes as full members. So this is a resolution of the intention of the Shoshone governing body to transfer to FCAG oversight of the ambulance services as somewhat discussed previously in the MOA, but essentially this is what begins the process for FCAG to administer and have oversight over emergency medical services, such as applying for the grant for the ambulance service through Shoshone and the fire districts, as I discussed previously, but as well as once it's fully formed and agreed upon by all parties, and then it was set up, that this would be the first portion of that step, is just the intention of Shoshone Town Council to have FCAG be the one that provides emergency management for ambulance services in Fremont County.
FCAG would just be what the government oversight.
Yep.
There would need to be
An advisory board.
an advisory board of, and proper people hired and everything. I mean, but the FCAG would just be the governmental oversight.
And this
You
resolution,
might, yeah.
it's not
You've been
binding.
involved with that.
Yeah, so it's not binding in a way like where we're signing over the
Right.
keys to the car. This is just the intention and the wish of Shoshone Town Council alone, that they would want FCAG to be the one that runs the ambulance service as opposed to the county or anybody else, is what it's saying.
And part of that came out with discussion with the tribes. correct, chief?
Yes, when we met with them at their business council meeting, that was, you know, I'll say it again, a historic meeting where they agree that this affects all of us and that we all should work on this to solve this together. And the best course to do that is FCAG, where all parties are represented as an equal seat at the table and not one dictating the terms to the other.
Anybody, council have any questions? Councilman Stabler?
Just making sure I was understanding this correctly, that we're like section 3, tribal full membership required. It is expressed the non-waivable condition of this resolution that each of the tribes becomes a full member of it. FCAG. I'm assuming that means not just on the oversight committee, but in its entirety.
Correct. Yeah, they're actually on the FCAG board as equal members, like Shoshoni, Riverton, Lander, Du Bois would be. They would have their own seat at the table as a voting member of FCAG itself.
On everything.
On everything. Correct. And that language in there is combined with Riverton and then, you know, the tribe's motion to petition to join FCAG that's where this comes in, because this is the mechanism that shows the intention that ties everything together. As far as the ambulance service being under FCAG, and granted, it's Shoshone doesn't have the power to just wave the wand to FCAG and give them the authority. It takes all the communities. So this is just our step of doing so.
That's FCAG has been having discussions with the tribes for maybe the last 2 years, year and a half, 2 years on, and the last 8, 9 months, probably even more, but we've been discussing on trying to get the tribes the mechanism to have them join FCAG, and it's but this is a big step forward. They agreed to make that move, because in the past we've kicked it around, but we've never got this far. But we welcome the majority of, I think all of the members of FCAG was look forward to trying to bring the tribes together, because they're an important part of our county.
I'll just read section 1 of what kind of sums this whole resolution up. It's the intent to convey Town of Shoshone in its capacity as a member of FCAG hereby authorizes and declares its intent to convey oversight of emergency medical services within the county to the Fremont County Association of Governments Joint Powers Board, subject to and conditioned upon the satisfaction of the conditions precedent stated in section 2, which goes into the tribes and the full membership of all representation of
Yes.
Fremont County being part of this.
Yeah, it's a good idea.
And Riverton didn't have this resolution when they passed a motion to do the same thing, but it was just a motion, it was an actual resolution, but same basic concept. They just didn't have one prepared at the time. But their motion was to join or direct, not direct, I can't remember the exact wording, but it was to move the administration of EMS services to be done through a joint powers board, specifically FCAG was their motion.
So I think this is a good first step. And Tammy, have anything, thoughts? Jordan, Councilman Wyman?
I think this is a great thing. I really do. Thank you for all your work you've done to help this go.
I wish I was done. We still got a long way to go. This is a process. Unfortunately, there's lots of little steps like this that each community has to take to get there, to get this started. But once it is fully operational and under local government oversight and accountability and transparency and control, and accountable to each community as well as by and through FCAG, I think that I believe that the services that are rendered will be much improved from what they currently are.
This is a big deal. I mean, it takes a big effort, so.
Can I, if there. See if we had a motion yet, or,
We haven't.
okay, can entertain a motion? To approve resolution 26-0010 joint powers FCAG.
I move that we approve resolution 26-0010, is that correct?
0010, yeah.
0010.
Second that.
Moved by Councilman Nordine, second by Councilman Statler. That we approve resolution 26-0010 joint powers FCAT and ambulance agreement. Any further discussion? None being, all in favor, say aye.
Aye.
Aye. Opposed, the same. Motion passed, all in the affirmative. Let's move down to D, Main Street Road closure. You want to discuss that, Chief?
Yeah, the hot summer nights set to change the dates of the tournament from the 2029 to the 11th and 12th. So we are requesting to change the closure of Main Street to be tomorrow effectively through Sunday at 5 p.m. Specifically the 100 block.
Right. This is something we do every year.
Move that we close the Main Street as we have historically. Friday the 10th through Sunday the 12th. For hot summer nights.
Second.
Been moved by Councilman Stedler, second by Councilwoman Harkey, that we close Main Street 10th through the 12th. What was the times again?
Tomorrow at 6 in the morning through Sunday at 5 p.m.
The motion was specifically as we've done historically.
Okay.
But that would be the time frame.
I wasn't sure what we do every year, but
Been moved and seconded. We have any further discussion?
I'd like to abstain.
you're gonna go talk to that guy.
Note that
Jesse's.
Councilman Whitener abstained from voting. All in favor, say aye.
Aye.
Aye, opposed the same. Motion passed, all the affirmative.
And Mr. Mayor, I don't know if you entertain maybe a possible 10-minute recess to
Well,
get
that's
everything
exactly
ready.
what I was gonna ask for.
Okay.
I need to use the restroom.
Doctor House. I moved that we adjourn for a 10-minute recess.
Second.
Been moved by Councilman Nardine, second by Councilman Stiller. We have to take a 10-minute recess. Favor say aye.
Aye.
Aye, both same. Motion passed, all affirmative. Get rid of some of this nice tea.
Are you on some butter?
Have a motion to go back into regular session. You can make motions from the floor. We have a motion to go into regular session.
I'll second. All right.
Moved by Councilman Stedler, second by Councilman Nordine. We go back in regular session. Any further discussion? None being, all in favor, say aye.
Aye.
Aye. Opposed, the same. Motion passed on the affirmative. So we're here this evening, we're gonna discuss the project. Wyoming Cardiopulmonary Services is proposing to put a regional center here in Shoshoni, Wyoming. We have Dr. Gary Idlechick with Wyoming Cardiopulmonary here. And we also have from the Wyoming Business Council, our regional director, Patrick Edwards. Dr. Idlechick is gonna lead off and talk a little bit about the project, and once he gets done, we'll take questions, and else there's something that you need to wave your hand. He's talking right now that we need to address, and we'll try to work on that. We'll work with that. So, Dr. Idlechick, we sure go ahead and lead off. And
Good evening. Can you hear me okay? Can you guys hear me?
This is for our Zoom.
Oh, okay.
That really didn't mic.
All right,
that
so I
doesn't
have-
put out there.
All right, sorry. I have a low, quiet voice. Can you hear me okay?
Now.
All right. Sorry for the delay. I had a procedure. I had to take care of a sick patient. So basically, as you're probably aware, we would like to help establish a centralized clinic here in Shoshoni to service the surrounding communities. So kind of taking a step back, there are very few businesses we can say are probably in Shoshoni, let alone Casper, that have existed since 1978. That's when our practice started. And we basically grew the practice by providing services and care to people in Lander, Riverton, Shoshoni, Hermopolis, Worland. So these are decades of established referral bases and patients. The idea is to better provide care for this community and the surrounding areas. And as you may or may not know, Wyoming has a tough time attracting talent. The guys like it, the women don't. And so we constantly are fighting for lives to try to attract people. And as you may or may not know, in the next 10 years, there'll be a deficit of 135,000 physicians in the country. So to meet the needs of a kind of increasing resource that's of minimal availability, we sat down and thought, what's the best way to continue to provide care for people in the community? And one of the things we thought very strongly about that could be improved is availability. Currently, we drive to Riverton twice a week. We drive to Lander every other week. We drive to Thermopolis every other week. Currently, we are not going to Worland due to manpower issues. We get 100 new referrals every month. And because of availability and the logistics of us needing to drive, many patients at much financial burden to them need to come and see us in Casper. So we have a diminishing resource, which is physicians in Wyoming, including mid-levels, which we are trying to grow as well. We want to improve access to care so we don't have to deal with people being life-flighted to us emergently that I have to address at 2 a.m. And more importantly, we want to be able to people have the knowledge of knowing if I need to see a cardiologist, I just have to drive to my local cardiologist, which is either down the street or 30 minutes away. So the idea behind the clinic is very simple: increase access for the community, thereby improving efficiency and delivery of care. Now, you may look at this as, well, what does this mean? You know, this list of stuff, Miss Lander, which was another failure, all these clinics did not have the patient base over decades. We're almost here for 50 years. And our plan is to be here for another 50 years. The establishment of this clinic is not a flash. Okay, we're doing this because we want this to exist after we're gone, after you're all gone. That people will go to this clinic, your grandchildren, their children, and continue to get care. And unlike other options, this is a high-level, non-seasonal industry. Patients get sick all the time. You know, the best businesses are alcohol, mortuaries, and doctors, right? Everyone will always go to those. So we want to help also Shoshoni from a business aspect by creating a nidus to grow future healthcare specialties. We have already got an interest from Hot Springs, from infectious disease, from Rocky Mountain Oncology, even from Casper Orthopedics, utilize the building that we would create. So we look at this as a win-win for the community, for us as clinicians to provide care. We can keep doing what we're doing. It costs us less money. But the problem is we don't provide the care we expect to give to our patients. So that's the whole focus of us going forward. And again, we've been here for 50 years. We're not going to make a decision that bankrupts us, that puts us in a position we're not financially viable. And that's why, in part, this is taking some time. We want to be fiscally responsible to you as a community, to the state, the Wyoming Business Council, and to ourselves. Because if we're insolvent, you have no cardiology. You can ship to Billings, you can ship to Utah, you can ship to Colorado, that's fine. But I think it'd be better to have people who are your neighbors, who are committed to the people of Wyoming, care for you, who we do things all to the same level that they do, if not more, because we don't have the willingness of certain specialties to take risk that we then have to take and take care of patients with excellent outcomes. So that's the basis of why we would like to help build this building that would be Wyoming Cardiopulmonary's branch in this region. Okay.
Any questions from the council?
I have one. So if it's a clinic, not a hospital. So say Joel has a heart attack, you guys aren't open, so he's gonna get flown out to Casper anyway.
Well, so again, so you're made a very astute observation. A clinic is not a hospital. The idea of seeing a specialist is to prevent you from having a heart attack. So if Joel actually went to me with the symptoms he was having and walked through the door without a referral, which we don't need a referral, I would have diagnosed him before he had this heart attack, which I do consistently and continuously.
My dad had no issues before he had his massive heart attack.
Well, again, you know, we look at risk factors, we do stress testing, we listen to what the symptoms are. I've had many patients who've seen primary care physicians, we're told there's nothing wrong to them. I take them to the cath lab after listening to the story, and they either get open heart surgery or stented.
And that will
So-
have to be done in Casper.
Well, unless we can continue to grow this community. So again, the limitation of a cath lab is very simple, number of people. So Lanter had a 1.2 cath labs. The first one, we had a business model to help staff Lanter's cath lab, okay? They didn't have the patient population to maintain it, but we presented a business model to them. As you may or may not know, that former CEO got in bed with a guy named Corval, okay? They decided to open up another cath lab, which, by the way, thanks to me, Banner now has as one of our cath labs in Wyoming Medical Center. They only had 60 hours of tube lifeline. That's a brand new machine. Corval's work I had to fix on many, many patients. He wasn't here to take care of people. Let's be frank. He was here to come from Louisiana and cash a check. Okay? There are many people who have inappropriate loop recorders that we have to deal with from Lanter. that we don't even know why they have it. They want them out, and we have to tell them, we're sorry, it can't come out. He also had a vascular surgeon working there that had to correct a lot of his work. So unlike Corville, who was here part-time as a tourist, who, by the way, they owe Boston Scientific at one point, 1.5 million, because they couldn't bill correctly and they were doing procedures they weren't allowed to do. That's completely as an aside. We don't run a business like that. Okay, we do everything by the book. We follow all guidelines. And now you can bring up Hoskinson. What happened to Hoskinson? Does anyone know? Why did they fail?
Well,
You had a billionaire crypto guy financing.
they built a building with suede leather seats and a lot of exorbitant expenses that were way too much, but they also provided too many providers for not, they didn't build into the population. They built a system that should be there.
So they built a $250 million facility. Part of it was a museum, right? So if you're going to build a business, say you're going to be a builder, right? You need contractors, right? So you want to start building a building business, right? Do you start looking for contractors who will help you? Or you just say, I'm going to build a building and I'm going to be the biggest construction company, have none of the base in place? How would you do it? Wouldn't you first say, well, Joe, I heard you're a great plumber. I have a vision of building houses.
Actually, you'd get a general contractor. That general contractor would find your.
That's great. I'm not.
And you
talking
would
about-
stair step
Sure.
it and do it that way.
So.
Please
he had-
address the chair.
Yeah, so by the way, he had no.
I'm
specialty-
addressing, you know who I am.
They had no specialty services that they could provide. They built a building. So if I was Mr. Hoskinson, and I have respect for him, although I don't think he's a very good, smart businessman, I would call Gastroenterology Associates, Gastro Orthopedics, us or whatever cardiology group is by there. But be like, guys, listen, this is my vision. I want to have a Mayo Clinic here. You don't build a building which remains empty, outsource everybody with locums, you're going to lose money. And say, how about you start seeing patients for free here? 1 day a week. Right? And then you go, you know what, GI guys, how about if I build an endo suite? You do endoscopy there 1 day a week. And we'll kind of figure out the technical fee to help you out, right?
All I want to ask is.
So just hang on.
A little bit quieter. Can you just speak?
Sure.
Because I can't-
Sorry. Yeah.
Ears.
Okay.
Yeah, I wish you had sorry. I wish you had a microphone. So anyway, Hoskinson failed because he invested money with no base to patient population, none. And in fact, we're recruiting somebody from his practice and he said they didn't even have approval from all the insurances yet to even see cardiology patients. And he's a cardiologist, so hopefully we can get him, but that's a different story.
Monica, do you have a question?
No, not really. I'm listening and I'm getting ready to jump in. So the Hoskinson thing, it was a $250 million building with
That's what I just
20,000 clientele. Okay, in Gillette, it was huge. In comparison, it's huge to most places in Wyoming.
But
So
he
if we
did,
look at Shoshoni and we're looking at possibly a $10 million building
no,
with the
it's not.
surroundings and the clientele, how does that weigh?
So no, it
Sounds to
won't
me
be,
like
so it
You're
won't be,
building a building.
so it won't be a $10 million building. Let's start there. We were given a quote of 10 million. And I told Joel that's not going to fly, period. So that's why there's a little bit of a delay in what the actual cost will be because we had to go a different approach. So we're trying to get to probably 5 mil or less, to be honest with you.
Okay.
Two, the patient population we're dealing with is 15% of the state. And Wyoming Cardiopulmonary has over 20,000 charts just in Riverton alone. And you can say, well, how does that work? Because basically that's including people coming from Du Bois and the surrounding areas there. We have people coming from Powell to see us. So we have a much bigger patient base. The problem, so we actually, I kind of want to see if I can get the patient numbers from Hoskinson, because I read the same Oil City News. Based on the person we're trying to recruit, he was seeing at most 5 to 10 patients a day. Me as an individual provider, I see 30.
In an 8-hour day.
My day starts at 6:30 AM and ends at 6 PM.
No, that includes rounds.
No, when I'm in the hospital, I'm in the hospital.
Okay.
Okay,
So
I don't, so when you even
taking
look at,
care for 30 patients in a day, as a
because-
cardiologist, that's not a lot of time per patient.
so I come in, I look at all the charts. You can ask any of my patients what type of care they get.
But you're just one.
That's how my whole group works. Now, they are not as kind of, I mean, overachieving maybe as I am, there's a number of patients, but we take excellent care of patients.
Okay, so you said in your opening statement that you want to be a part of and help build this building. Okay,
Correct.
so does that mean that you want to design it, have it, work in it, but it's going to be the town of Shoshone that has to take out the Wyoming Business Council loan and use their programming and put their land on the line?
Well, that's,
So if
that-
you want to build this and you think that it would be such a great thing and be so successful, then put your money where your mouth is. Buy the land from the town of Shoshone and build your building.
so again, so Patrick will go over all the details of that. You know, we're not in a position to invest immediately $5 million.
But you have so many patient clientele and so many.
I don't
different
think you
doctors.
really
so many
understand
people that-
how healthcare reimbursement works.
I do understand how
Oh, yeah?
reimbursement. works.
So what's the average,
20%.
No.
Secondary insurance. Yeah,
the return on average, you're doing well if you get 15 cents to the dollar.
yes,
So that's actually doing well.
okay,
So I don't know many businesses that say, you know, this costs this iPad here in front of me, $500. And I say, you know what, I'm gonna pay you $5. So, you know, we do well, thank God. I'm not wanting for anything, but we're not what healthcare used to be 20 years ago. So again, and our investment goes beyond just the infrastructure. There's the human personnel side, which are salaries that are not even involved in what the cost is, keeping the lights on as well. So with this is actually employing MAs, nurses, techs who hopefully are in this.
so are these employees, are they going to be people that are traveling with you? Are they going to be local?
So we
Where are
want,
they coming from? Because we don't
Sure.
have that here.
actually, that's incorrect. So they have nurses, obviously, that work at Hot Springs
Yes,
facility.
in Thermopolis
Yeah,
and
and
other areas.
Riverton, and we have nurses who've already come up to us telling us they're interested. So we
Okay.
want to have people who we employ ideally be here.
Be Here,
In the.
not in Shoshone.
in
So there's not
Shoshone.
any property tax that'll be paid by anybody because it is a medical hospital facility. There's not any sales tax because it is medical. So Shoshone will get zero revenue. And you're going to hire your nurses, your techs, your x-ray, everything from Thermopolis, from
No,
Lander, from Riverton.
actually, there
So
are
the menial
nurses.
jobs
Sure.
that would be provided here, maybe for a couple of people to clean the building, a couple of people to mow the lawn.
Well, I think you're
Oh, wait,
correct on
The
that. So,
town is still gonna own the property, so isn't it gonna fall on them to do the maintenance and maintain it?
no, it's actually gonna fall on us to maintain it.
Mhm.
Two, there are many nurses, believe it or not, who actually travel from Shoshone to Riverton and to Thermopolis. So, and they've actually expressed interest to
There's
us,
a couple.
okay? MAs as well, yes,
so sorry.
Sure.
So soft and it's
Okay.
wonderful, but I just can't.
sure, sorry. So there are people who actually live here who have the requirements and they are interested. Sales tax, again, we're not here to sell things.
No, you're not.
But if you have a density of 40 new people coming into town every day, they will need to fuel their cars, they'll have to fill their stomachs, okay? This is not traffic that's commonly here, and it's gonna be here year round. So the idea hopefully is to have flow through of 80+ patients a day. And we should be able to get that because I can see, when I go to Riverton, we do 10 echoes, I see 30 patients. With a mid-level, when I go there, we're seeing 50 to 60, actually 60 patients. And we're not covering the patients that need to be seen. We're not covering all the new patients that want to be seen.
Well, I I'm not here to argue.
But you don't come every day to Riverton. or
We go, well, again, this is a manpower issue. We go twice a week to Riverton. We could easily go 4 times a week.
And so do you, in Riverton, in your outreach programs, do you hire locally or do you bring them with you?
Here we just go local because we're there temporarily. The idea is to change that model.
So you bring staff with you.
We bring an Ecotech with us and we bring an MA with us. If we have a front that we have to maintain, we're gonna have front desk, checkout. We want a local MA. We want local nursing. And the idea behind the local nursing is not just to hire from the community because it's nice. It's also logistically, if we can't get here physically because of the roads closed, but the nurse can go to the clinic and help take care of people, like call us, get prescriptions filled easily. Okay, that's important to us. Excuse me?
So you can do that on a portal to get your prescription.
Yeah,
Exactly.
so portal, so you're okay. The portal, there's a delay, right? INRs can't be drawn on a portal. Blood pressures can't be checked on a portal. EKGs can't be performed on a portal. Those are all nursing requirements.
That a nurse could do if the roads were closed?
Yes,
She could,
she can open the
well, she may
lights.
Be able to draw and she can do the blood pressure. She's probably not.
You can
gonna
do-
that.
Would say the last part, sorry?
Didn't you say an echo?
No, I said
Oh,
EKG.
an EKG, which
Yes.
you may not.
She can do EKGs. She can put Holter monitors on. She can put event
And then
monitors on.
if they're having a heart attack. she'll
If
call
they're
light
going,
flight,
if
so they can fly
any,
up the cast
so
radio.
again, a heart attack is a different thing, okay? If you cut your arm off, are you gonna go to your primary care physician and be like, are you able to reattach this? You can't determine bad things happening. What you
That's
can
right.
do is,
So that was gonna bring me to my next point.
Okay,
You had
so
said that.
can I complete my
No,
statement?
If Joel had come to
Well,
you.
no, I should be
No.
allowed to complete my statement.
Just-
you were
Okay,
talking
Go
in
ahead,
circles.
Greg.
excuse
No,
me?
You're talking in circles,
No, I'm not.
kind of.
No, not at all.
I
I
have
mean-
a question.
Sure.
Just when you were online the last time and voiced in, and we talked about some of the benefits that you thought you were bringing and such, but one thing I wrote down in my notes was the cost of the building. I heard you say something around 5 million, but on that call, you said 7.2 to 7.5.
So we were getting all these different quotes, and actually the final quote that we got before we changed gears and we went a different approach was close to 1,200 a square foot, which is insane. I can build a custom home for 450 a square foot. And that's making it very, very nuts, right? So it just made absolutely no sense. And we didn't get we didn't even have a dialogue. Why is this the price?
Well, I knew that
Yeah.
it was at the 10 million and then it had came down to the 7.2, 7.5. So I just didn't know.
We actually, to be frank, we don't have a number.
Yeah.
Well, I have a target that I'd like it to be 5 or less. That's the goal.
This around 7 million, that was the maximum that would have been that wouldn't have been the maximum number that could have been considered, and it came in at 10. And they were estimating around 7. It started out originally at 5, and we don't know why it went from 5 to 7 and 7 to 10.
Correct.
But we had a $1.42 million HVAC as part of it.
Yeah, it just doesn't make any sense. Anyway, so we went through the numbers. I know what we can afford as a practice to pay a lease or a loan. And going through those numbers, knowing what the percent interest rate was, we had an upper limit we could go. Ideally, I don't want to hit that upper limit. I don't think it's beneficial to anyone.
So what's wrong with the clinic that we already have here? Why can you not be in there?
That was my question.
So I think what we're doing is having a paradigm shift in delivery of care, right? To just say, we're in this building now, and the people from Riverton, why don't you drive to the same clinic you already go to that doesn't provide any further services?
No,
Oh,
no,
I-
the Shoshone Clinic.
I understand. Well, I'm asking those people to come here, right?
Uh-huh.
We don't provide nuclear. We don't provide echo. We're trying to change the delivery of care that we're giving. You need something big, right? You need, just putting a shingle up, we're not changing the way we deliver care to people. It doesn't, in a way, if you're going to make a brand new car, right? This car is electric. Are you just going to put the same badging, call it a Ford Taurus, and expect people to think it's something different?
Dr. Idlechick, also, our current clinic is only 3,200 square feet.
It's smaller.
Yeah,
So in this clinic, you'll do nuclear and you'll
Yes.
do,
And if we have the patient population, we'll do cath. Okay. But I need to build that population up,
Why can't we do that in Lander?
because you don't have enough people.
How's it gonna work here?
Because we draw more patients independently. So the Lander did it as a hospital, right? So they wanted to have their patients be capped. How many bedded hospitals, Lander? Do you know?
6 or 4.
Yeah. Our patient population exceeds the bed number in Lander. Exceeds the bed number in Sage West, both Sage West, and also the new hospital being built. So for elective procedures, which when I'm in the cath lab, I do 7 a day. We can do them here. But we need the correct density of patients. Currently, half our population is from this region that we do in Casper. If I can increase it by probably another 50%, I have the model that's required financially to do the procedures here.
Dr. Idlecheck, just a quick question. Would your intention be if the centralized here in Shoshone, either satellite offices where you do go would then be closed? And
That's
they
correct.
would, I mean, I understand, Lander's there, going from Worland to Lander is much different than going Worland to Casper, but going from Worland to Shoshone is a significant distance changer, so that your population vicariously was changed because of all the other communities around.
That's
Shoshone.
correct.
But those all would close.
Those all would
just in
close.
Shoshone.
Correct.
and your patient population, how do they feel about that?
They're actually very excited. In fact, 2 of the patients who I dealt with prior to coming here are very excited for this to happen. They said, good luck. They said, I'm running a month late. I go, well, I have to take care of your loved one.
So my other thing is, I wonder about core infrastructure capacities and the safeguards for that. Town of Shoshone has no water. We have crappy sewer. Sorry, no pun intended. We are struggling with water meters. We're struggling with all of those things. This building is gonna need a lot of water. And electricity. Electricity. Now, we get a good storm, nobody has any power. There's not any power here. So is that going to fall on the city to make sure that there's water and sewer and extra power there?
we
Or
have
how's that gonna work?
We have plenty of water. I'll address that. We have plenty of water. And one of the things we need to do is improve our infrastructure. And with the BRC loan grant, that funding can help us do that. I mean, could be a big boost for the town of Shoshone. That could be a real asset for us. And it's clinic. I didn't know a clinic was
We
known
don't-
for using a lot of water
We
like a
don't
data
use,
center.
yeah, we don't use that much water.
Oh,
I mean, outside of washing hands, and typically now after you wash them once, you just use the scrubs that are disposed from a dispenser. It's
Okay.
actually more hygienic than keep washing your
and
hands.
power?
Power, yeah, we need power. That's, if you move to any city or build any building, the city has to provide power. That's, I think, a moot point.
But
Even if
is our
McDonald's-
infrastructure strong enough to provide power for the equipment, the x-rays, all of those things?
Cath lab, all that.
Cath lab.
Well, the cath lab, that'd be a whole different story, right? We would actually have to build it, we would have to have a generator. So that's completely, we need to, we'll power that without Shoshone even having electricity. Yeah, that's a safeguard. The power that we need for nuclear is no different than you putting your dryer and washer on in your house. We're not gonna have a CT scanner at this point. If we evolve to CT PET, again, the amount of kilovolts needed is again what you need to charge your Tesla. So if you drive a Tesla, you're kind of maybe hurting the place too. Go ahead.
We don't, we're from Wyoming.
Okay, my question is,
Could you please come up?
I'm so sorry.
Thank you, young lady, appreciate it.
Good evening, Dr. Idlecheck, and I appreciate you taking the time to come over here. It's a good long drive. We spoke before when you were on the Zoom call. My concern is only, I guess we're on the same page on this particular thing. My concern is the patients. I'm visualizing several things. The first item is when we have a power outage, our washer and dryer aren't, no, I'm not trying to sound sarcastic.
Sure.
When we have a power outage here, we don't have our washers and dryers working. I'm not saying that you use a lot of power, but I'm saying when we lose power, it's all gone. So to counteract that, are you thinking that you would need a generator? And I'm thinking of a fairly significant size generator. It won't be just a little home
Sure.
gas powered thing that you plug in. Have you considered at all how you might address that and where the financial responsibility for that would fall? I guess the town.
Or we would purchase it. I mean, at the end of the day, we need to function and we're very IT heavy, seeing patients, right? Everything we do is digital at this point. So if we require, if, you know, I don't know the full specifics of the electrical grid in Shoshoni, but even in my own home and our current clinic, we have generators.
Right.
Okay. So we would then have to purchase a generator.
Okay, so you've basically already covered that contingency and it wouldn't be a new cost after the fact.
There are many costs that are in the proposal that don't include what we're going to pay, knowing we want to provide it and we will pay for it. The most obvious is the salaries and benefits that of all the hirees. Two is the equipment inside, although the one big beautiful bill is kind of another avenue we're exploring. We've gotten a lot of positive feedback from the state to apply funding from it for the equipment inside the clinic. So that would help us offset our obviously significant,
For sure.
yeah, a significant initial cost. But I think, you know, we view it as not just an investment for today. We, as I said before, this is a heritage investment. The idea is not only for us to practice in care for patients, it's the future Wyoming cardiopulmonary president, which I happen to be, his people that he works with. Ideally, if things are, you know, based on the input I got from other subspecialties, they're kind of heads of the practices, there is a very strong opportunity to build a multi-specialty practice here, okay? And we're not here to compete against Sage West. We're here to work with them. We're not here to compete with the new hospital. What is it called? River Peak. River Peak.
Yeah.
We're here to work with them. What we want to do is make sure care can be provided to this region. And it's a substantial population of Wyoming. 15% or more, actually, depending on how you draw the boundaries. I mean, people require care and we want to give it to them. The way I view it is whenever my family and I moved, the first thing my parents did was, what are the schools and what are the doctors?
Right.
Right?
Yeah.
And for any community to grow, having the knowledge that, hey, I have easy access to good clinicians. That's also a nidus for growth. Now, the growing pains that comes with that, the infrastructure, everything else. I mean, look at any major city that's growing, thanks to the draconian policies of like Illinois, et cetera. Tennessee, Nashville, it's a disaster, right? So many people have moved there that the infrastructure can't even keep up. Right.
Yeah.
But that's a good problem to have to some extent, right?
Well, it depends on whether you're receiving the money or paying the money and you need the help or you're giving the help, I think.
Well, so I think the one way to view it is this is not like Shoshoni going out on its own, paying for things. And I think Patrick will address that very, very nicely. It's a kind of an agreement because these are public funds that we don't have access to.
Right.
Understood. The idea behind having access to the public funds is we're paying for the loan.
So
I think I'll speak for a lot of the community. The concern is the loan, A, the town being attached to it. B, if you default,
Sure.
I mean, we can just quit kicking the can down the road. I'll just be blunt and that's what it is.
So I think, let's say the worst case scenario, say we become in a position where we're financially quote unquote insolvent, right? Which we would never go into a venture like that. Let's say that happens. What do you think will happen next? It's pretty obvious, but
Just
just
have to
curious.
close this. facility.
No, actually we'll be bought by Banner. So that's what's going to happen. Okay, so they will have to buy all our assets because they can't go without cardiology.
Well, you wouldn't close them all, but you
No,
could
we-
close this one.
No, we wouldn't. Yeah, that would be part of their purchasing of our practice, right? Our financial worth would be negotiated, just like any other takeover, right? So if we get to a point where we go, Banner, you know what? We need help, right? They will buy our current practice. They'll buy any extension practices, okay? And then we become employees of Banner.
Or
Or they
close
close.
this one and you maintain your personal one.
Banner would love to have this as an option.
They may want to.
No, 100%.
But
So 50% almost of the patients we do procedures on come from this region. Right. So imagine you lose that pipeline. The only reason why we have cardiovascular surgery at Wyoming Medical Center is because the person who started this practice drove all through this region, seeing patients every day, while his partner was doing call at the hospital. And then they would switch. That's how they got the density of people to actually make Wyoming Medical Center not a gallbladder pneumonia center like most community hospitals, but a major trauma center, a major cardiovascular surgical center, neurosurgical. The only reason why that exists is because of Heiser. If he didn't put the effort and time to take care of cardiology patients in this region, the hospital would be just like Sage West. That's the legacy we come from.
I have another concern,
Sure.
please. So just imagine, because we're not talking about specialists who understand what's going on. We're talking about Fred who has a farm. Fred who has a farm lives halfway between Riverton and Shoshoni. And he knows that you guys are gonna be, he knows that you guys are here down the future, 5 years from now. And he starts having chest pain and his wife decides to bring him to Shoshoni, the closest place to be.
Sure.
But it turns out that he needs medical help, and Sage West is not where you want to go when you're having a true crisis. I know you know that, everyone does. We're like a small community hospital. So he would still have to be sent to Casper. But in the meantime, that valuable time that has been lost when he left the house and was driven to Shoshoni and now has to go back to Riverton. And I know you know this, and I'm not trying to argue with you. I'd love to see the town just grow, boom, we were prosperous. But I don't want us to trip just before we fall into the well. And so my question is, how do we let it, the community maybe down the road, how do we let them know? Do not come here if you're truly having a problem, because you're gonna have to go to Casper.
So it's kind of interesting. So being in Casper, like across the park from Wyoming Medical Center, we still have patients who are brought to us basically needing to go to the hospital. We have them with active chest pain, fluid congestive heart failure, had one in cardiogenic shock. So, that's very difficult. We have people driving to Douglas because they hate Wyoming Medical Center, right? And then they get shipped back to us. And their car is over there still, and they have to come back.
So you're saying it would basically be the same.
Not necessarily. So what we always tell patients, look, if you have an emergency, number one, call 911. Because that's the logistics in place to deal with acute care. That's across the board. I don't care if you live in New York City, you live in Nashville, you live in Shoshone. No clinic is equipped to deal with that. We have many heart attacks going to their primary care physician. They do the EKG and then they get shipped to us in Wyoming Medical Center. We take care of it.
Right.
Now, not maybe addressing that question per se, that's education. That's all we can do. How do we tell patients to go to the doctor if they're having chest pain, right? It's another issue. These delayed presentations of multiple different healthcare issues.
True.
That's education. And we do want to provide education to the community. We feel that since we're physically going to be in one spot, it's hard when you go to your outreach clinic and you have 30 plus patients waiting, and then to make time to meet with people.
Right.
Everyone wants to go home, right? But what we want to do is try to make hours during the day during the week, I should say, maybe once a month, have just kind of what we call education outreach. And we hired a new mid-level who she's a doctorate in nursing. She wants to do this. Okay. But that's a problem the American College of Cardiology has dealt with, the American Heart Association. Education goes so far. How many of you can do CPR? Why not everyone?
Because people want to depend on their doctor. I mean,
But CPR, I can't help you, right? If your loved one drops in front of you,
that's
right?
the mindset we're looking
Sure.
at.
But if someone drops in front of you, it's like, my view of the 2A amendment, right? If you're calling 911, it's already too late.
Right. Do you have any plans down the road? This has been addressed so many times and discussed, but the nearest hospital, and they're managed by a company in Tennessee. They're not local. They don't know what it's like in Wyoming. They are living in a place where you don't have to go more than 5 miles, maybe not even that far, to get to the next hospital. They're everywhere. Out here, it isn't like that. And here in Shoshone, it isn't like that. Do you have any plans down the future to maybe somehow, and I can't even imagine how you could do it, but it needs to be considered, have a hospital that would be more, that would promote your kind of work more, or any kind of specialty, because Riverton Hospital and really the one in Lander, they're not really equipped for specialty, big, serious things.
So the way we kind of view this and kind of going forward, we need to have density, right? So even say, for example, having a cath lab, okay? If we do that, I need to have the right number of patients. And, I think if we have interest from Cody, and that's actually quite a significant number of patients, because going to Montana and coming here, it's almost equidistant, okay, to get care. So eventually that could happen. Now with a hospital, right, to have off-site cath lab, you need to have established relationship to then get that patient to a surgical center. The only thing I can see is that relationship has to be built between the facility, let's say River Peak, right? They're new, they're kind of the hot thing right now, whatever, okay? Say that they have to establish it with Banner that they have a life flight chopper available, okay? So that part is kind of hard to address. One thing I've been in talks with the CEO of Banner is having a shuttle service set up if it and when this building comes up to help patients get to Wyoming Medical Center and back home to this region. So all they have to do is park their car. They don't have to pay for the expense of the gas. They can see their loved ones or get the testing they need and then come back. So that's kind of more of low-hanging fruit, if you will, for us to address as just a specialty clinic.
Right.
But I think it'd have a huge benefit for the community, because I have many patients that are willing to sacrifice financially to come and see me in Casper.
Sure, yeah.
And I know it's difficult for them. And if we could help offset that cost, I think it'd be significant. And that's another reason why we want to be local.
I know you kind of addressed this, and your voice is so wonderful and soft. At least it's not harsh and irritating like mine is, but I was having difficulty hearing part of what you
Sure.
said, so you may have covered this. If you did, I apologize. Why do you want to have it here instead of in Riverton?
Because I drive through here on my way to Riverton,
Okay.
right? So when you look at Shoshoni's actually geographically
In the
brilliant.
center, yeah.
It's awesome, right? In fact, I have other ideas of things that could be here. But if I look at, I want to deliver care to a large group of people that have the biggest reach. I always have to drive to Shoshone to go to Warland, Thermopolis, Lander, unless I go via Muddy Gap, obviously, and Riverton, right? By being here, I don't make it an excessive drive for anybody who I normally drive to. And instead of windshield time, I have patient time.
So really, this would be a great idea. As long as you're not anticipating having really serious cases that would have to go to Casper anyway. If they're coming to see you like on a regular basis.
So again, acute care, things happen. Even with my most tuned patients that we've done everything for, things happen. We're just human. But for the majority of patients that we deal with, and I can speak for myself, obviously, I've caught very significant things early. So they didn't have a heart attack. They didn't lose their heart muscle. They didn't require open heart surgery.
So you'd be seeing them here, maybe identifying a problem, hopefully identifying a problem. They could go to Casper and have the care they need.
Yes, ma'am.
I really appreciate your time. Thank you so much.
Thank you.
I have a couple.
Go ahead, Councilman.
How many days a week do you think the population that you forecasted will support your services in this area?
We could do 5 days a week.
Is that what you're planning on
I'm
doing?
going to start with 4.
And so will you bounce between Casper and here, or?
We're going to have a rotation like we do now. So the idea, instead of rotating through Therm, Lander, Riverton, we'd probably have a physician team or physician mid-level team that's 1 week dedicated to just coming here. Same physician.
So 1 week, 1 day a week, you'd have physicians?
No, 4 days a week. 2 physicians or a physician and a mid-level, depending on how call schedules are, vacation time, etc.
The other question I have for you is why or how does that corner, that specific corner, help you?
1 is visibility, 2 is access, 3 is its location.
Just curious as if you considered any other pieces that we have?
They're kind of a little bit off the beaten trail. So we want a big sign, we want people to see us, we want them to go here. So when you drive by, Wyoming Cardiopulmonary is there. You know that's where I need to go. You drive by it every day. It's like the fast lane, right? You don't know anything about Shoshone. You know the fast lane. Why?
Because I've lived here my entire life.
No, but I'm just saying, I am not being from here, right? So the majority of traffic, right? So they drive through Shoshone. What do they, I'm not trying to be condescending. My wife thinks Casper is ugly. I love it, right? So what do people think? See, they see the fast lane and they drive through, right? Why?
It's on the corner.
It's on the corner, it has a good sign, it has good frontage that tells you exactly what the business is, right? There's no way to ignore that gas station exists here.
But that's retail. You're trying to attract retail versus not retail.
Well,
I'm just not understanding how you.
So
I'm not understanding your tourism piece of how that's going to benefit your business when you're saying you're attracting people from Thermop and et cetera area. Well, that's not what our traffic piece is.
So.
mean, sure, there's probably a small percentage, but a lot of it's out-of-staters that are
Sure.
passing through, that also pass through Casper,
But
that
they'll-
also pass through Billings,
Sure.
that also pass.
Sure, so I'm not talking about tourist traffic, right? Although they'll see Wyoming cardiopulmonary, and there is a possibility they may not feel well, and they stop inside the building, okay? That could happen, right? But the other aspect is there is traffic that is business related that goes through, right? And if I'm driving from Riverton to here, it's easier than going to Riverton to Casper, going to Lander to Casper.
I don't think you understand my question.
Let me help with this. It's one of the things. Wyoming cardiopulmonary be a nice big building, big sign. There's people from Wyoming driving all through back and forth. They're gonna see Wyoming cardiopulmonary like a big billboard advertising their business. And that'll be advertising that business for people that are traveling in-state residents back and forth will see that. And that's having a nice big building there with a big sign. That's a positive reflection on their whole business. Being next to Fastlane, which is a great building, you have two nice buildings, makes the whole town look better. And people will get to know the name. They don't know it.
And I think moreover, people are gonna be using the fast lane more by default, right? So that's actually increased business. Because they're gonna come here, they're gonna wanna go grab something. If you have flow of 80 patients a day, you can help support a restaurant, actually.
I can't speak for Fastlane, but I imagine that anybody that's coming from Thermop and or Riverton and or Casper already stops at Fastlane anyway.
On our way to Casper, where they
Well-
can go big box shopping and.
Well, I'm gonna go stop at the fast lane now, right? But if the fast lane was just a little low down gas station. let's
It
say.
was.
Yeah, no, I know. I remember the reconstruction. I was here for that. It's not very memorable. If the Shell across the street was open, you just pull in the Shell, right?
We
Yeah.
closed the show in 2010 because we had no business.
Yeah, no, I
We built
understand.
this and opened it in May of 2022.
Why did you
But
have
so
the-
the way I view it
We had
is, we want to
business
be,
across the street.
There you are. That's why.
Even better.
so you want to be visible if you're gonna basically make something big. And the thing we want to make big is not just our own practice. The goal is to make it a multi-specialty practice as well. So we want to be visible because we're putting a lot of time and effort to make this successful. We're changing the whole business paradigm. If we're gonna do this, we want to go with a splash. If we're just.
I understand it. I'm just saying, why is that? Why, how and why is that corner so beneficial for you than
Access.
a different corner? Or a different-
Well, the corner across the street, we could do that one. Do you own that one? The gas station?
The Shell.
Yeah,
I'm just
The old
asking
substation?
of why.
And you can put the other
There's other places that have that.
it was for sale.
They're on the beaten trail.
It's a correct location. It's right at the intersection. It's easily accessible. That's why.
We also have 5 acres and was my question. Have you seen the other pieces?
I don't want to see any other pieces. I know which one works for us. That works for us. You know, I'm not trying to be negative to your point. If we're gonna do this, we want to do it correctly. Part of doing it correctly is to be
To
visible.
me, part of doing it correctly would be looking at every.
And that's what citizens want. It
And
doesn't have to be right in the center. of
If you
town.
want to speak, please wait, just wait. We got some,
So-
just get in line, just get in line.
So just curious, what would you rather have there? Just curious.
Just kidding.
A McDonald's?
No, I'm kidding.
You know what, we have in Casper, where's the hospital? Is it right as you're coming into town? Or is it as you're leaving? No, it's in the middle.
No,
Is
it's
any other community?
Casper Hospital is not in the middle. That's absolutely incorrect.
And I'm just using it.
So-
as an
not
example.
on Main Street.
It is. Second Street is Main Street.
But we have to go through, all through the town to get to it.
You have,
Is Lander Hospital right as you come into town? No. Is Riverton's Hospital as you come into town? We have.
well, yes, it is.
Farmington open
And River,
places. Well, now it is.
And we're not a hospital, but we're not a hospital
Why right here?
because that's the location that does the best thing for us. Pure and simple. What would you rather have there? McDonald's?
I'm not
I'm just asking you, what would you rather have in that location?
You
I'm
know
ju-
what? It's gonna be big is what you're saying, correct? So we have the mushroom farm that's not even being used. Lots of property out there. Why can't it be out there for an example?
I don't need much property. I need the space that's available at that city hall. That's all I need.
No,
No, but again, you're asking me a question. I asked you a counter question. What would you rather?
Yeah.
No, how am I being out?
Hey, sit down.
No, we don't do that. We don't do that. We
He
don't
doesn't have a voice to allow him
Okay.
to be arrogant. I think we can all agree with
Hey,
that.
Jody, you've been waiting patiently. Please speak.
I have two questions.
This is
One-
Jody Lang, right?
Yes, John Jody Lang. I have a question for the doctor and I have a question for Patrick.
Yes.
Perfect. So you want to come here, which is, I think it would be great. What does the town get in return?
We haven't got that far yet, man.
Well, we talked about a little bit.
get there.
So from your standpoint, what does the town get other than just taking care of people?
Well, so I think it's a good question, right? So if you have a business that takes care of things year round, right? And that becomes a kind of a nidus for people to go. You get traffic, right? So that's one thing. So by default, people will come, even if we don't do anything, right? We just see patients here. That's all we do. They will be using resources that are here by default, right? So if I'm here and I got a stress test and I got to be here for 4.5 hours and my family's here, what do you think they're going to do? They're going to go eat something, right? They're going to go cruise what's here. They're going to fill their car, right? From the standpoint of providing kind of this higher level business in a way that dovetails with other businesses that do the same thing, orthopedics, infectious disease. I think PM&R, sorry, which is rehab, okay? Those are things we've got an interest, hem-onc, nephrology, actually as well. What does that do for the town? You become a medical hub of the region. Maybe not for acute care, that's a whole different aspect, but for chronic and maintenance care. So you're not just Shoshoni to drive through, you're a medical hub to take care of people. And that has a lot of draw. It attracts people to want to move in a way because they know they can get care. I know many people who their issue when they leave a place or move to a place, do they have access to physicians? With density of people comes other needs, and usually that's service industry needs. There's a potential for growth in those areas. But that's entrepreneurship. And I have a few ideas that maybe they'll work, maybe they won't. But obviously that's in the back burner. That maybe those 5 acres would be useful. I have no idea. Okay. But if you look at it from the standpoint, not that we just want to build a building and just do business as usual, but that we want to build something bigger than we are, it kind of changes things. And those interests already exist. And we already spoke to Joel about modularity and growth possibilities, and there are. But we have to start from the beginning. Okay. And the only way I can start is I have to at least get my flag in the ground, start the business here, show people how it works, get other people who have interest to then start joining. Okay.
Mr. Chairman, can I address part of it too?
Yeah, yes, if you'd like to.
All right. Well, I haven't had a chance to really speak yet, but thank you guys for having me tonight. So my name's Patrick. I'm the regional director for the Wyoming Business Council. The Wyoming Business Council is the state agency that does economic development. We've been in the news cycle quite a bit. I'm sure you've heard lots of things, whether they're true or not, I'll leave up to you. But what I will tell you is I'm going to shoot very straight with you tonight and tell you exactly how these programs work, what they're intended to do, and how they can benefit a community like Shoshoni. So how many of you are aware that we've already spent business ready community or now building resilient community money in Shoshoni? A couple of people. So the rail spur that exists here in Shoshoni wouldn't exist without our funding. That was Wyoming Business Council funding. We actually built that custom design facility for the town of Shoshoni to create jobs. And thank goodness Curry Rail is here and we have those jobs back and that facility is full again. Also, there's a sewer line that goes out to the mushroom farm. I heard that brought up. That line was put in through business ready community funds. We do infrastructure which is what I call invisible, that's in the ground. And we also do buildings in some cases, depending on what the what the application looks like and various factors. So for this particular one, it depends on how the application comes through as far as what the community would get out of it or not. What I will say to the doctor's point is you do get a thing that we call in economics called tradable income. So when more people come to your town and you have more people employed in your town, especially through primary jobs, so jobs that pay, at least, your livable wage, which we heard earlier from the chief over here is about $21 an hour. When you have more of that, you have more traffic, people spend money in your town. So those dollars then circulate in your town. Okay. So that's how tradable income works. But besides that, as part of our grant portion of our program, so we have two functions of BRC. We have a grant portion and we have a loan portion. The grant portion has what's called recapture on it. So we work with the community. So this is another misconception that's in the news and with the legislators is that when we do these projects, we do the deal with the town, with the community. Okay. We're not doing it with the doctor. We're doing it with the town. So we look out for the interests of the town first. We look at the project and we say, does this look viable? And we have to have an application to do that. And I don't have an application yet, but what we do is we look at the application, we say, does this work? And then we work with the town and we go through the process if it's a thumbs up, right? So let's say it's a thumbs up and we have a grant portion of say $1 million, just as an example. Okay. That grant is going to the town of Shoshoni. There's a recapture portion of that, which is typically around 75%, that the town, as the business pays off through lease payments, as they pay off that part of the grant, because they have to pay that back to the town. Okay. It's a grant to the town, but it's a loan to them, basically a 0% loan. 75% of that money stays here. So that's $750,000 that would stay with the community of Shoshoni for future economic development. Now that could mean, I heard water brought up. Okay, we need a new water line. We need to update the water system. Okay, well, you can use it for that. Let's say maybe you need to put in a new road so that you can have a heavy industrial business site, a location here. We could do that with it. So that's how the grant portion works. Now the loan portion is a little bit different. What we do is we typically will take that and we'll have a 1%, a 2%, or a 3% loan. And it depends on the term of the loan. We like to have a blend of both grant and loan. But on the loan side, those interest payments that the business is paying come back to the state of Wyoming. They get reinvested into this BRC program for future investments. So let's say Worland has a project. Well, we could look at using it for that or whatever. So that's how this could benefit the town. I've seen other places, Laramie, Sheridan, Cheyenne, all kinds of different places. They use that recapture to beef up infrastructure, to beef up whatever they need so that they can continue to grow and provide those jobs. So hopefully that answers your question, but that's kind of how that works.
So, cause I know, we said that there's no taxes that the town gets or generates. So that's why I was asking, how do we get,
Yeah.
We put him here, he doesn't sell anything, we don't get any tax base out of it.
Well,
That recoups some for the town.
sure.
That's what I'm asking.
I would say some of that is partially correct, some of it's not. If you have more sales in town and you have more people dropping cash when they come through, that's a net benefit for your town. Not only that, I heard the question about the location. If I'm a business, I want to be on the corner. I want the visibility, and people are going to start to associate Shoshoni with not just, hey, it's a place that's got this really great gas station called Fastlane where I can stop and do all these things. They can say, oh yeah, and there's Wyoming cardiopulmonary. And what that does is, again, it helps you as a town because more people are coming through, more people have that recognition. They'll start to associate the town with more healthcare. And to the doctor's point, who knows? Maybe that does mean that you get more clinics, more things. What I can tell you is it's really scary how fast the state of Wyoming's average population is aging. We are aging extremely fast. We're losing our kids to other states. If you look at the census data, it would floor you, especially in comparison to Idaho, Montana, and Utah, because we always talk about, oh, we're just like those guys. No, we're not. We are getting older faster and our kids are leaving. So the need for care is going to be more in the future. The other interesting thing that I've heard a couple of times, because the chief was talking about it and we were talking about the EMS stuff, density is a huge problem in Wyoming for healthcare. We don't have it. Outside of Cheyenne and Casper, just to give you an example, EMS goes in the red everywhere else in the state because they don't have density. Cheyenne and Casper, they can make it. The rest of us have to subsidize it to keep it. So, like with opportunities like this, I would say just keep an open mind, right? Work through the process. I can tell you there's a lot of checking and things that we do on our end. The doctor's familiar with some of it already, but there's a lot that we look into because ultimately we want to look out for the town of Shoshoni. We want to make sure that the people here aren't saddled with something, because I heard something about, well, what about the worst case scenario? Okay, let's go through that. Let's say that for whatever reason they can't make their lease payments. What do you think the state of Wyoming is going to do?
Take it back,
Take what back?
the property, the building.
How does that help the state of Wyoming? So yes, we'll have a lien on the building. Okay. Just like any lender would, but why would we want the building? We don't want the building. We have no interest in having an empty building in Shoshoni, because what we want to do is get someone else in there to pay the lease so that it can get paid off. That's what we want. So what would we do? We would come alongside the town and we would try to find somebody to take the building. And we would work with you until that happened. And we would not send you to collections. We would not stack all the interest payments. State of Wyoming is not going to do that because that doesn't benefit anybody. So just so you know, on the state side, that's how that works. Does it happen? Very rarely, because we try to do our due diligence on the front end to make sure that whoever is coming, right? It's called a business committed, business ready community grant loan program. We want to make sure that that business that's committed to do what they say they're going to do is going to do what they say they're going to do. Okay.
And I think that was part, that's a concern. Is
Absolutely. And it should be.
whatever,
Yeah.
The town is on the hook to pay for that
Yep.
until, we're eating that up, and if that happens to crash.
Yeah.
But if the state is, that's how that works. I
Yeah.
didn't know how that worked. That's
Yeah,
why.
we don't want property in Shoshoni. The state has a lot of property as it is that we can't even maintain. Okay. Have you guys looked at a state map and who owns what across the state? The state of Wyoming has a lot of parcels. Okay. It costs the state a lot of money to manage all those. We don't need another one. Now, what we will do, like I said, worst case scenario, you have an empty building. Our recruitment team will go out and they will make phone calls and they will try to find somebody to take over that building. That's how we work. Do you guys remember a few years back when Brunton left Riverton? That was a BRC building. Now they maintained enough of a presence to stay there, and thank goodness they're all back and everything's running good. But let's say that the worst case had happened in that situation where everybody had left. What would we have done? Exactly what we were prepared to do, which is go find another business to come in. So that's what we do. Because a lot of people think that we're like a bank where we're holding all this money and we have to get all these interest payments. Otherwise, we're going to send you to a credit agency. This money has been appropriated already by the legislature. It's sitting in an account. We have no reason to spend all that effort to send you to the collections and do all that. Plus, we ruin the partnership with the community. So we're not going to do that. So I just want to make that very clear. Like, the reason that we have a non-recourse, yes, the debt is still there, but we want to help you guys if the worst case scenario were to ever happen, find somebody to come in that would pick up those lease payments. So just want to hopefully put your mind at ease on that one.
So in that gray
Yeah.
area where there's not somebody to pick up those lease payments,
Mhm.
what does that look?
The building sits there.
Says we can't make the lease payment ourselves, so
Yeah, so the building just sits there until we find something that can go in it.
So with those
my
payments,
next question is. I'm just trying to understand. I ask a lot of questions when I'm
Yeah.
educating myself. In that instance.
Yeah, no worries.
In that instance, if that happens. What repercussion, if any, would the town have? In the next situation. Of, you know. Grants through you guys,
Mhm.
XYZ, if this one were to fail.
Right. That's a great question. So let's say everything fell apart and the building's sitting vacant, and then you guys came back to us, say for a water line or for something else. What we would do is we would look at, did you follow up with your reporting? Did you do all the things that we required of you? We would not hold you accountable for the fact that the business left you high and dry. Okay. As long as the town is working with the Wyoming Business Council to try to get that building filled, we're good. Okay. As long as you're doing your reporting on time. That is one thing with our new rules that we just came out with. As long as the town is staying up with reporting and doing what they're supposed to do, you're in good shape. If you don't, then it does affect your eligibility for future grants and loans.
And that would be any project we did.
Yes. And real quickly, this is really important. The process of doing this, there's not a ton of steps to it, but you do need to understand the process. So how this works is the town will work with the business. They'll talk to me. You have the public meetings, right? So everybody knows what's going on. If the town decides to move forward, what'll happen is the town will put forward an application. That application will come to me for a first review. I will then work with my team and we go through all the financials. We go through all the due diligence on our end. We make a recommendation to our board. Then our board will vote and make a recommendation to SLIB, which is the State Loan and Investment Board, which is the top 5 elected officials. So you've got the governor, you got the superintendent of schools, the treasurer, the auditor, and the secretary of state. SLIB makes the ultimate decision on all of our projects. It's not the Wyoming Business Council who decides. It's the top 5 elected officials. Okay. So that's how this process works. That was a real quick overview of how this goes. But ultimately, those 5 people will determine if this project were to go through, if you guys all decide that you want to go through with this too. Because a lot of times I hear this in the news and from legislators, well, the business council did this, business council that did that. It's actually SLIB that makes that decision. We make recommendations. We do our homework. We try to work with the communities to make sure this is, something that's going to work for you and going to help you, because ultimately that's what this program is designed to do. But ultimately those top 5 electeds make that choice. Okay. So just keep that in mind. Okay. Let me make that clear. Yeah.
You've answered a lot of my questions, so I appreciate that.
thank you.
Yeah, you're welcome.
Any more questions?
Yeah. This question is for Dr. Idlecheck. So as soon as everything is up and go, and the first day that the clinic is open for business, how long from that point do you anticipate it taking before you need to have it open 5 days a week? Like, how long will it take before you have the
Sure. So
patient base?
I think currently 4 days makes sense. Incremental increase to Friday is kind of dependent on also guys wanting to go home for the weekend, right? So I think if we do the 5th day, regardless, it'd probably be a half day. Just so people can go back to Casper. Yeah. So I think the way I kind of viewed it from a density of patient point of need will probably be 4 days a week pretty easily for 6 months. And then we'll sit down and talk about additional half day. We'll want to implement echo and vascular imaging right away. Initially, because it's difficult to find well-trained people that fit our need for being accredited, you'll probably be selling their travels with us initially. Things can change. I can't determine who's available and who's not. If someone from Thermopolis, for example, or Sage West wants to join us, we will train them appropriately. That's not an issue, okay? I think that will all roll out together. Obviously, treadmill stress testing, treadmill echo, that will be rolled out immediately. Event monitors, EKG, Holter monitors, simple things, right? Nuclear, I think will probably wait for the 6 month to a year mark. Because I have to understand the patient flow and dynamics, right?
Right.
And also just to get things set up and make sure I have all the appropriate logistics in place, including the appropriate technician, right? We want the dedicated nuclear tech for here. We don't want travel.
Right.
So I would assume that would be at that point. For the growth of additional specialties, the design of the building includes 3 rooms for another provider specialty. And based on the interest and discussions already, I think that should be moving forward within 3 to 6 months. Now, it may be even quicker because there's a construction phase, right?
Right.
So we anticipate it'll be a year construction if things go forward. We'd like to quote unquote break ground ceremonially as soon as possible because there's been people waiting. And I think they'd be comforted to know it's happening. During that time, we would start getting all the associations together as well. And also recruitment. If we can start finding people from this region, from Shoshoni, from Riverton, they want to help us care for patients at our new clinic, we will work to get that going from day one when the doors are open.
If you had the staff, would you be able to treat 5 days a week? Would you be able to be open 5 days a week or maybe 6 days a week?
So that's a good, well, 6 is difficult, right?
Yeah, I know nobody wants to work weekends.
Yeah, I used to work weekends.
I have
So-
worked my entire career weekends because that's where hospitals want you.
Well, yeah, so I was
Right,
on,
Saturday, Sunday.
yeah, I was on call 3 weeks in a row, so.
Yeah.
3 weekends lost. But usually the outpatient setting, it just depends on the clinic setup. Is that doable? Maybe in the future. I think more tenable would be at least a half day on Friday. If we have the opportunity to have a mid-level in the region, say, who joins the practice and wants to dedicate their time to this clinic specifically, that changes the algorithm, right? And then we can be open 5 days a week, depending on the desire of this person, perhaps 6 days a week.
Right.
Okay.
So this is not a gotcha question at all. It's not intended to sound like that, but it probably will. Since you are already going to have such a large patient base, and this as well as I do, for medical practitioners, no matter, well, even for hospitals, word of mouth is the most important form of advertising you have. So what I'm hearing, and I could be wrong, explain it to me if I'm wrong, but the advertising on the corner doesn't seem like it would be such an important thing because you already have such a huge patient base in this area.
So we do have a very large patient base and we have a lot of referrals. What we don't have is easily accessible building for them. And we also have a lot of people who have no idea about this. They have no idea about cardiology, even in the state of Wyoming. We have patients showing up to us in the hospital from areas we service, say, we were told there's no cardiology.
You got to be kidding. In the
No.
last 15 years, I don't think I've talked to anyone about medicine who did not know about you.
Yeah, seriously. We're told by people who come to the area that there's no cardiology here. from people we send patients to for specific things that we can't provide. Those institutions tell them there's no cardiology.
Okay, thank you so much for your answers.
My questions are for the doctor. I'm a retired RN. I graduated from Pasadena College. Judy Kavanaugh, Dr. Kavanaugh was back in the 70s when I graduated. He was a cardiologist. His wife was one of our instructors. So I worked in Powell and I saw that. One of my questions is the veterans. We have a lot of veterans in the area. And is there any way, I think the big concern is the amount of money going out on the town's part. And then the question of the revenue coming back in and making a difference, because I saw things fail in Powell. I worked in Red Lodge and we had to get traveling people. And so they make 3 times the money. And so I had years and years of experience, but I was not making as much as the travelers because they were traveling.
Sure.
So those are things that I hope can be hashed out before it ends up where it hurts rather than adds to the community and actually does a service. And I would like to see help for the veterans to where they don't have to travel and they could be more local and get the services that they need. And is there funding that could come from that?
So
Is there a way to research more funding sources so the town, because we're not against adding it to the town, it's the amount of money that has to come out that is concerning.
well, I think kind of Patrick addressed some of that.
I can speak to that.
Yeah,
more.
but just quickly about the vets. Unfortunately, there's something called the VA system. I hate to say that. I've taken care of a lot of vets. And in fact, I was fortunate in my residency in Michigan. The majority of my patients were veterans. Okay, it was a VA affiliated. And then where I trained at UT Southwestern, they had a Veterans Affairs Hospital, which I rounded in during my training. There are some very excellent flagship facilities the VA has. The problem is, like any other kind of concurrent system, there's a bunch of bureaucracy that's involved that doesn't provide an ounce of patient care and demands a significant amount of resources. We as a practice have a very large VA base. We work very closely with not only the VA primaries, but the VA institutions in the region because we have to get approvals.
Yep.
Okay, and we work very diligently to make sure that happens, that all my patients, when they need to be seen, that's taken care of, which is a testament to the quality of people that we have in our practice, who we actually have a very low attrition rate, and thankfully we have an incredibly high competency rate. People love to work with us, thankfully. We have a bunch of good people. So that's how we would address the veterans. The other aspect with that is something I kind of brought up earlier, is kind of working with Wyoming Medical Center to have transportation available during the week, potentially the weekend, but the week obviously is easier because that's when drivers usually work, right? To have people help shuttle people back and forth. Yes. Yeah, that's something I worked with. I've been talking with Lance Porter, the CEO of Banner in Wyoming Medical Center. That's something we'd like to implement. I wish I could fix the VA. I really do. I rather, in my mind, what I would do, maintain the flagships, cut everything else out, give private insurance to everyone for free. Done, Yeah, granted, they made some good deals with regards to cost of prescriptions. I would look into that, how I could kind of grow that with that type of model. But the access has been incredibly deficient. I don't disagree with that. the financial aspect, I think Patrick will be able
Mr.
to
Chairman,
talk.
may I jump in?
Please.
Okay. So I provided some materials to all your council members. This is a document that we created on our website. It's called How to Structure a Deal. And the whole point of this is for communities so that they understand kind of what kind of skin has to be in the game, because towns do have to have some skin in the game. Now, I will say, remember I mentioned there's two pieces. There's a grant piece and a loan piece. For the loan piece, there is no match. Okay. What we do is we have to make sure, that whoever the business is financially viable. We work with the town just to explore all that. Now, on the grant side, where you get to keep a portion of those payments back, I talked about recapture. There is a 25% minimum match. Now, this can be done in a number of different ways. By the way, this is on page 4 of that document that I was talking about. So that 25% match can be done a few different ways. 50% of that has to be cash, but this can include cash on hand, appraised real estate, not previously BRC funded. So we wouldn't want it to be something we did previously. And design work completed within 6 months of the application. So that can count. We can also do what's called in kind. And a lot of our small communities do this, right? This is not uncommon because towns like Shoshoni and a lot of small towns don't have a huge cash reserve, right? So the other thing that we can use is valid in-kind sources, including labor, materials, and land. Okay. However, grant administration, operations, maintenance, and grant writing are strictly ineligible as match sources. So if you're wanting to get that recapture from the grant side, there is some skin in the game. If it's strictly loan, then again, like we're going to finance that loan. You're going to have an agreement with the business as the town, and then that business is going to have to make those payments in the form of lease payments. So when you talk about money out by the town, really the scenario of money out from the town would come in the form of, if you go after the grant and you want to get some of that recapture money, then you would have to come up with something. If you're doing strictly loan, you're not going to have to. Okay. It's just going to be basically, we're loaning to the community and the business is making the lease payments. I hope that makes sense. I know it's kind of confusing, this program. Again, it's been around a long time, but it is a little bit of a head scratcher sometimes. But that's how these are structured, because we don't want small communities putting out a whole bunch of money to try to do these things, because quite frankly, you don't have the revenue to do that. Small towns in Wyoming struggle. And so, but one of the reasons that we have this program is we want to bring businesses like this to your communities so that you can have something going on that adds to your base, right? That brings that tradable income to your community. Again, there's different projects that bring more base than others, right? There's some that generate a lot of property tax. There's some that generate a lot of sales tax. A recent addition to Riverton, some of you probably saw the Amazon facility open there, that really small last mile delivery. That's a $15 million building and they'll pay property tax on that. That's a huge deal, right? Now, one of the things about our program too that I should mention is we set up agreements and we have agreement templates. I really encourage all of you to go to wyomingbusiness.org, go up to communities on the top, and go down to this BRC program. We have tons of links. All this stuff is there. All this is public. We have draft agreements for the towns to use to protect the towns or counties or tribes or whoever our applicant is. Those are the only people that we can actually have as applicants. But we have those agreements in place to protect you, right? Like that is the idea, is we're here as a partner with you to try to ensure that all of this goes smoothly, that this goes the way you want it. So go out there and look at those things. What can happen at the end of this is, say the doctor wants to buy the building. Let's say that this whole thing goes through and they want to buy the building. That's fantastic, right? It's good that they own the facility. You want them to own it. And then that also is good for the business, because guess what? Now they have an asset. They can lend against that asset, right? They can go get lending. They can go get financing. They can grow what they're doing. That's in everybody's best interest. So again, these are things that we can talk about if we go down this path and go through all this process. but that's kind of how that works. So just so you understand the money side of how that goes, because we don't expect the town of Shoshone to pony up, $5 million. Like that's not going to happen today or tomorrow. Even the county, Fremont County, would have a heck of a time doing that. So, and the county is a lot bigger and gets a lot more tax revenue too.
And then the transportation piece, so you can get them from point A to point B. But what if they need help? The seniors, when we had a bus, we bought a bus and we can't use it because you can't even help somebody get on the bus, can't help them get out to the curb. You can't. I worked in Michigan for the Area Agency on Aging, and we covered 10 counties. And so we helped support, we would go into the hospitals when our people were in the community and they'd end up hospitalized, help them get discharged. So the support services, especially for older people, and we have a lot of people who go through, they go out on Boyson or they love the area. I want to retire here someday. So we have a lot of retirees.
Yeah.
We have a lot of need for this kind of care, but we just don't have the support services and the money to back it up.
Yeah, no, I hear you. It's a statewide problem. And the doctor can speak to this probably way better than I can, but I can tell you, having worked with Director Johansson from the Department of Health and looking at the state, it is a real struggle right now for healthcare. We are, like I said, we're aging, we're getting older as a population, we're spread out, we don't have density on our side. It's going to be a struggle for a while. And, you're hearing about it more and more. The chief took you through some stuff earlier about EMS, ground, and air. All those things are important, and they all affect all the things that we try to do to live here in Fremont County. I live just down the road here, not too far from here. And I'll tell you what, I'm very remote and these things matter. So I hear you. And it's something we're all going to have to work on together. It's not just the town of Shoshone. Riverton's talking about the same thing. DuBois is talking about the same thing. My entire region, which is Fremont, Sublette, and Teton, everyone's talking about the same things. So it's not just here.
Okay.
But thank you.
Thank you.
So this piece, and you explained it, on the required match,
Mhm.
but you mentioned that you can do pieces of both,
Mhm.
loan some,
Yep.
grant on the other.
Yep.
But now I understand why the corner's so valuable, because of what it probably appraises for, to help with the match. And so we could have just came out and said that sooner than later. But the other issue, or the other question I have is with the way I read this, correct me if I'm wrong,
Mhm.
is it's really, this process is more to the town
Mhm.
directly for
Yes.
you and your team per se. And then anything that is external is in an agreement from the town to the business.
Right. Yeah. So that's a great point. Again, one of the big misconceptions we had during the legislative session, that's why I provided this to all the council members as well, is that through the Wyoming State Constitution, we have certain things that we have to abide by. One of those is if we're going to be doing these grants and giving out this money, it has to go to our communities. Now, the way that it does help a business, right? If they want to come into a community, then they can come to the community. The community then has financing available to help them get things going or to help get them going. And so that's really how this is designed. We do business with you, and then you do business with the business. Okay. And we put those draft agreements in place, and we have those again. You can modify those. I've seen those done 50 different ways, but really those agreements are meant to protect you and set up whatever your expectation is. We have our own expectations, so we have agreements with you as well of like, these are things we want to see, and our board can ask for, job requirement, this many jobs required to be hired by a certain date, or created by a certain date. So there are things that can be done throughout this process. Again, it's very complicated, but you're correct. So our deal, like if the business council were to do this, it would be with the town of Shoshone, and town of Shoshone would have a separate agreement with Wyoming Cardiopulmonary. Wyoming Cardiopulmonary would be paying back the town of Shoshone, and that's how that would work. Okay. So we're the ones helping make sure that the financing can happen, because we know that Shoshone can't just shell out that kind of money.
The right way tickets.
Tickets.
Councilman?
We talked about a bake sale before, so maybe we could do that. I think that might help.
Do that too.
Yeah, the cookies.
Jelly.
Used to make years ago. I made a killer chocolate chip cookie.
I'm sure you did.
Alas, it's been
Wasn't
years. So my question is really complex, and yet probably answer it in just a couple of words, and that is so the town does the application with the business council.
Yep.
What type of timeline are we talking about?
Yeah. So I always say it varies. It really varies on the capacity that the town has to put the application together, right? So some places, like they have a dedicated person that's what they do. I mean, they write grant applications. They have their day job is dedicated to doing this. I mean, I think that you guys are fortunate. Joel's definitely dedicated. And I know you've had other people. I've seen you do several, Chris. And so you have people that put in extra time. And that's what we see across Wyoming. Wyoming people are built different. I'm one of them, right? Like if we really care about something, we'll work on it into the night and on weekends. And those are the things that'll happen. Plus, you guys have a resource in me who's available. So I will help as well. I can't write the application, but I can certainly advise the town on different aspects of this. Ultimately, you have to make your own decision. You work with your counsel, with your attorney to decide, what kind of liability risk you want to have as far as the agreements go, how you want to structure the deals. You get to do all of that. But typically, this takes some time. We have an application deadline coming up of August 1st. So if you guys want to be eligible for that particular round, because it's quarterly. So if you want to come to our September board meeting and present this, you would have to have it in by that deadline. And of course, again, like I said, you have resources to help kind of get you there. The nice thing is we have a lot of this stuff drafted. So really it's, you take like on the agreements, especially we have draft agreements. You can take those are kind of already there, modify those, make those what you need. On the application side, that's where the work really happens, because you have to work with the business to say, okay, this is the business plan. This is, how many employees they're going to hire. This is the benefit it's going to bring to the community. You have to put together kind of a presentation of what you're going to present, not only to our board, but to SLIB, right? So you got to go through a couple of different layers here. And it does take time so our board meeting will happen in September. The SLIB meeting would probably happen in sometime in October, early November. And then let's say it's approved, then we start getting all those agreements in place at that point. So nothing is done until it goes through the full process. And it takes a bit. So that's kind of a rough timeline. It could take longer. You may run into some things and be like, man, we didn't really think about this, and it may push it back a little bit. I don't know. But typically that's kind of how this cadence goes. Does that answer your question?
Yes, it does.
Okay.
I'd expect nothing less, but yeah, no, I was really curious about that because I know it's a big project. I had no idea how long all the different steps would take because there are multiple steps to do. So I know that our mayor is working with you quite a bit, Dr. Raya, and trying to put all the pieces together. So
it does take time, though. I will say, like, this is a fast track at this point, but part of that's because of what happened this last legislative session. We didn't even know if we were going to have BRC funding.
Right.
So a lot of people were like, I don't know what's going to happen, because heck, as an employee of the business council, I didn't know what was going to happen. So we were all kind of like waiting to see what would happen with the funding. And so that's kind of put everybody in a pinch because I have several communities around the state that are looking at this application deadline thinking, shoot, we got to move really quickly. But like I said, you've got good people and I'm here as a resource as well. So we can work on this if this is something the town decides they want to do.
Thank you, sir.
Yeah, you bet.
Appreciate it.
Got a
Yes,
couple of
Councilman.
questions. One you
Yeah.
kind of touched on, but I just wanted clarification. So if we, suppose we can get this application in and then it goes through and then goes through and then it gets approved at that point, we're still not locked in until we get the final, this is what we'll do and this is what we won't do.
Yeah, so you'll have draft agreements, right? That'll go before our board, that will go in front of SLIB. Once and those will be based on approvals, then you will all sign those, right? And so that's when everything is locked in. So then you would sign all those agreements and then all of that would essentially commence. And so you would then work with the business to get the construction started, work with them on all the different things that you have in those
I mean, as
agreements.
far as it's going through its different channels, can that somewhat evolve? No, we won't loan you this, yeah, or.
It depends on how you structure it, right? So let's say you put contingencies in there, right? And you say, you know, this has to happen before this happens as a town. You're more than welcome to do that. You can structure these agreements however you'd like. Again, we give you a draft, but you can change it
as needed.
and I would encourage you, work with the doctor. You want to make it a good experience for him too if this goes through. So you want to make sure that it's mutually beneficial, but you know, again, that's up to the town, that's up to the town attorney and the business to make those agreements together.
Yeah, the other deal, there's some information going around that, is this, it'd be a grant loan deal, or is the town gonna have to front all the cash and turn in receipts? Is that how that works?
Okay, so here's how it works. You have to establish and show a proof of match if you're going to go for the grant portion, right? So like that, and again, I listed out all those different things that could be eligible. So you would have to show and provide that to the Wyoming Business Council. And I mean, at that point, you're good on that.
Well, I meant construction costs.
Oh,
During
on the construction costs. Yep. So here's the nice thing about being a community, right? So let's say you get all that done. What you do is you, especially on the loan piece, which I think is easier, you know, you get the loan and then you just, yep, you got it and you start firing away. That's why a lot of people will do the combination because then you have prime cash in the pump, if that makes sense.
And so for the grant, if we end up with a grant loan, the grant portion, we've got to.
You got to
spread the
do,
cash,
yep.
just like every other.
It's a
grant.
drawdown. Yep. It's a drawdown. So,
Pay it, turn in receipts, get reimbursed.
yep. So that's where the loan comes in as kind of an important piece of this, especially for smaller communities.
Gotcha.
Yep.
And then the other concern that was brought up was, and we ran into this quite a bit, why our sewer, water and all that was so over budget is inflation and things like that. Is there any, helpful things built in? What can we do there?
Yeah. You're going to have to watch cost overruns. And I know the doctor's been looking at this too. It's really tough right now to build anything. So what we advise you in the process to do is to make sure that you build in some for cost overruns because have it in the agreement, have something built in because there's a possibility that will happen.
And that'd be up to us to get that in that agreement.
Correct. Just like a great example is River Peak. I mean, it's not cheap building a hospital and they ran into the same problem. So
Right.
you're going to have to watch
We
that.
ran into everything.
Yep. Yep.
Uh,
Unfortunately, that's what's just the new reality. Yeah.
So, okay.
One more question and then I'll quit hounding you. But on the piece for the town, you know, with the grant, the match, real estate having to appraise, part of that all being a piece. Correct me if I'm wrong, but my understanding is then anything that the Wyoming cardiopulmonary would be able to put up front or have skin in the game, that's actually, we're kind of like a pass through.
Yeah.
It's
So
up to the town, then the town would distribute it to you on our match portion of the grant.
the town is essentially the the landlord, right? So all we can do through our program is build the infrastructure.
Right, so just.
So we're not doing any equipment, we're not doing any furnishings, we're not doing any of that. So the company, the business is required to come up with their part of it. Again, the hiring, which he talked about, and having employees, that's the value add that they bring on that end as well. And then they're providing payment back to you in the form of lease payments. And we help figure out that amount.
In the grant match portion.
Oh, okay.
Like if, you know,
That's on the town. That's not on the
and so
business.
then If the town doesn't have the funds to match that grant piece, it
Then you-
pass down to maybe him. or-
Nope. Then you just don't do it and you do more loan. And that's going to be how you have to look at it is, again, choosing the loan side isn't a bad way to do it. It's just there's no recapture. But if you're in a situation where you don't have the cash to put up front, you do the loan side, because then you don't have to worry about that. Does that make sense?
It makes sense. I guess I was just thinking kind of outside of the box in the sense of.
Yeah.
Well, I'm in cardiopulmonary, had X amount of dollars to put forth. If that came to the town, was that help cover?
You might be able to set up an agreement with them of something like that, but that would be an agreement piece that you would have to design.
Gotcha.
Yeah.
Is there recapture 75%?
It can be. So when you do your application, you basically propose an amount, right? Our board can change that, SLIB can change that. I've seen that happen actually. So we had a project in Wyotech and Laramie where they applied for a massive loan as well as, some grant, and they looked at that and they modified that number for the recapture on the grant piece. That can be variable. I just know the tenor right now of SLIB has seemed to be that they want the state getting more. So I don't know if they'll stick with 75% or not. I think since you're a smaller town, they'd probably leave it at like 75%. I've seen it be as high as 80%. It just depends on the application and what they decide to approve. I wish I could say there was more science to it, but there's not.
And so the recapture means that if it's 75% from $1,750,000 goes into the coffers of Shoshone.
Yes, which is huge for a town. Yes,
So
Especially to help with infrastructure.
it helps a lot. Yeah.
the match was changed to 25% of is that the total? It's still the total project, not just the grant portion. So if the project is 5 million.
Yep.
Then we have to come up with 25%.
If you're applying for 5 million grant.
Yeah,
Right.
just-
And so it's only 25% of the grant. So if the grant was going to be 2.5 million, so it's not the total project, it's only the grant portion of the 20.
Right.
Okay. That was a clarification I was asking.
And that's part of the reason why I'm aggressively trying to get the construction costs down. What we were quoted was pure insanity. Number one. Number two, it's not fiscally responsible as stewards to try to help the town or for the state. So we have a number in mind. We think we'll get there. Unfortunately, we're delayed in getting that quote because the people we're working with, once we started questioning, disappeared.
They abandoned us.
So, but part of that match doesn't necessarily have to be cash. It can be the property itself.
Right. Crazy.
Yeah. So
Would it be any like labor that goes into like running that? So I'm
yeah.
gonna let the council know I'm gonna charge
Well,
$50,000 fee
Not on the right.
day. I'm doing this.
So on the writing, no, but so I can read this again, but it's like it says cash match, at least 50% must be cash. This includes cash on hand, appraised real estate, which that was not a previous BRC project, so that would work fine. And design work completed within 6 months of the application. So the labor of the design work and the costs associated with that can be counted as match. Grant writing does not count.
I was just kidding with
I
that,
know.
but
Some grants
you can't
allow
blame me
that,
for trying to get a little something out of this.
Yeah.
But let me just clarify. So if Dr. Idlecheck has skin in the game as far as on the design front, and could that be passed into the town to be included in that cash
Absolutely.
match that way?
But it would have to be with an agreement.
It has to be through an agreement and it has to be within that 6-month window.
Okay.
So it has to be within 6 months of your application.
Demolition counts as well.
So yeah, if you put in work into the land, so say, because you're gonna have to. That, a portion of that can be counted, but again, remember, there's still that cash piece. So regardless of how much, like, say you get a huge amount in other work, it's not gonna reduce that cash piece. But again, you can play with the numbers too as a community, and you can say, well, we're gonna do 1 million grants and 4 million loan, and see what that, we have a calculator in the application where you can figure out what that looks like, and you can change it and make a decision based on what works best for the town at that point. Because you have to make sure, again, that you're covering your fiscal responsibility, because you don't want to overextend yourself
Right.
on a cash match that you can't make. So that's something that, again, I can work with you on, but it's something to keep in mind.
Question.
Yeah.
Is it best to do both? If you can do both? Or is it better to do one or, just do the loan part? Or is it better to do both if you can do the both?
So I'll tell you guys a little secret here. I know this is on Zoom, but so I think it makes more sense to do both, because when we have a community that will come and just ask for a grant, we're like, right? Because we have it set up as grant and loan for a reason. We want to bring some, it's called in statute adequate consideration back to the state of Wyoming. So we are helping you guys out, right? So we do want to get some interest back, and we want to put some money back into that account, just like you would want to get recapture for your town to do future economic development. We want to do the same thing. Right. So we will like to see a blend, and whatever that blend looks like for your town, do it based on what looks right for your town. Like if you're bullish and you want to try to get, some recapture, I would encourage you to go after it. But there's nothing in the rule book that says you can't ask for 100% grant and you can't ask for 100% loan. You can do whatever you want. But my recommendation as your regional is try to do a blend of the two. It's more favorable to the board and as well as SLIB. So
It's more favorable to the town too, with the recapture piece.
yep.
Yes.
It's helpful. Yep.
For the doctor, how long have you been trying to get this in Shoshoni? Has it been in the last couple of years, or have you always, at some point, has always said we need to get to here?
Sure. So I've been in Wyoming for about almost 6 years. I joined Wyoming Cardiopulmonary. And when we were driving through here, it's like, it'd be really nice if we had something. Speak up a little bit. Okay. So when I joined the practice about a little over 5.5 years ago, we would drive through and I'm like, why don't we have a clinic here? And then I saw the sign for sale and called. So it's been in process for about a year and a half?
In August, it'll be 2 years.
2 years.
Yeah, I was gonna
Almost
say,
2 years.
I think we've been talking for a couple of years about
Yeah.
ideas and different options, and
So is it just you, or is there more of a group of you?
Yeah, there's 5 of us.
5 of us?
Yeah, we have 5 physicians. We're recruiting 2 more currently. We have 5 mid-levels, and we're recruiting 1 more. We have 4 nurses. We have a bunch of medical assistants. We have right now 5 echo techs, recruiting another one, as well as our nuclear tech. And the idea, hopefully, is to evolve this as an independent entity with those services provided. The physician arm, I told Joel, if a guy wants to move to this region and wants to do cardiology with us there, sure, right? I have a tough time getting him to Casper.
you need to
But
find a
other-
walleye fisherman that
Yeah.
likes.
Yeah.
fishing.
Find a doctor.
I've got to,
Wide
so
location.
it's, what's amazing is we get a lot of people who are interested and then their wives have no interest coming out. That's been the issue. I'm blessed that my wife loves it here. And she's not huh?
And some women there.
Well, it's funny, right? So
They'll be happy.
well, look, it's not, I had a single buddy that I was trying to recruit. I'm like, dude, there's plenty of people. you know, he goes, oh, I don't know, he's from the city, right? And he just didn't, it doesn't connect, but so he didn't join us, it's okay, we're still buddies, right? But at the end of the day, recruitment's been difficult, but I'm working on it. We got some decent leads again for physicians. But you know, we already have a very strong base, and that base, again, I can't take credit for the practice. What I'm trying to do is steer the practice for continued success so we can provide care for the community with the resources that we have. And that's not been easy. Okay. And the way that's where kind of everything melded together when I drove by one day and picked up the phone, when I saw the sign and said, this is a win-win for everybody. I can help my patients, I can help the town. Okay. And I think we can actually build something pretty amazing, not just from my standpoint, which I obviously is a key piece. That's the you know, the foundation, but because of the interest we're generating from other specialty providers, it could be a very beneficial healthcare aspect, and then all the other intangibles that come with that by becoming a kind of a hub for healthcare. You don't have to have acute care to be a hub for care.
Thank you.
This question I have for Joel. Our last city council meeting, you said you had to go out of town to a doctor. I asked you why you didn't go to Casper, and you told me you fired him. Why would you want him here then?
Pardon?
I said, last time we had a city council meeting, you said you had to leave to go out of town to go to a doctor. I asked you, why didn't you go to Casper to them? And you told me that you fired them. So why would you want them here?
I didn't, which doctor we talked about
The
last
heart
time?
doctor.
Heart doctor?
Yeah,
I didn't go to Wyoming Cardiopulmonary.
you went up to Billings.
Well, I went up to Billings, but I wasn't seeing Wyoming Cardiopulmonary. I was seeing what?
Casper cardiology.
Cardiology.
Right.
And I was not happy with them. I didn't know nothing about Wyoming Cardiopulmonary. I have a sister that lives in Billings whose daughter is a nurse.
They've been there 50 years.
Yeah, I did not know about them. I have a sister that lived in Billings. And she said, get your butt up here, walk into the emergency room and stuff like that. And that's exactly what I did. And they was able to take care of me. I did not know this was 5 years ago. Did not know Dr. Idlechick. I didn't know nothing about Casper Pulmonary at all. I had a doctor, had a heart attack because I had my primary care physician didn't diagnose me properly with my problems. If I'd had Dr. Idlechick, I'd have never had the heart attack.
There's still Novak and Yvonne and Beck and
Now, Novak retired. So Casper Cardiology is a completely different practice. We fired the person who started that practice. And the legacy continues with the practice. So Dr. Novak retired.
well,
It's part-
everybody that gets flied out gets flown to Casper Hospital and those doctors come in.
That's my group.
Right, that's what I'm talking about.
So I'm kind of confused. So
So
Joel.
I guess what I'm confused about is something about last council meeting, you said you fired the Wyoming Cardiopulmonary. Is what I understood.
No, I don't know what you're talking about. I can't
You
think.
said
I don't
you were
either.
going
I'm
to
trying to
Billings
figure it out.
I can
doctor.
clarify. You're asking about the last council meeting when my dad was not president, is that correct?
No, he was here.
Recently?
He was here.
Or the one before?
Because he
when
said he had to
Billings, 'cause
get
it
up,
wasn't a
go
heart
early
doctor.
to
Hey, wait,
Billings.
come on, settle down.
No, he just
Who
said he
are
had to
you?
go early to Billings.
Hi, Smith.
Okay.
Hi. So I was, about your question, I guess, was confused because,
Well, because he had said that when he needed to get up early the next morning to go to Billings, he had to go to the heart doctor.
Oh, no, I didn't go to the heart doctor.
yeah,
Yeah. and
I know I
asked
did.
you,
I know you guys got it all
and you
screwed
said You got a
up.
splint up there.
No. I went to see my eye doctor.
you went.
I
Okay, well,
fired the eye doctor in Casper, not the heart doctor.
Yes.
I went,
That's what I was trying
I
to
need
clarify, 'cause
I
was here.
I need to have a consultation about cataracts. I have cataract. I just don't know what years ago, I was 5 years ago when I went to Billings but that was Casper.
Yeah, he hasn't fired me yet. so-
No. That was not,
Not recent.
I had cataracts, not
Hey, well, you
cardiology.
Well, that's just what it
Cataracts.
said.
Cataract.
Monica has, Patrick keeps saying no density, but idle check says density. Loan and grant, just a loan, and make idle check by the land. 10 million loan, Shoshone supposedly get 112,000 a year, but on 5 million.
No, not 10 minutes.
I'm reading what she's saying, okay?
What's that?
Monica,
Okay, she's wrong.
okay,
It's simple.
everybody's wrong but Joel.
No.
5 million, what do we get? People spend here, getting on doctor's appointments when we have nothing. But FL, and they already come here on the way to Casper. If he can create a Shoshone to Casper shuttle, why not just buy the land for a car park and shuttle to Casper for apartments and save everyone? And she goes, I left because I had to work in the morning.
So maybe we should talk about
Yep.
this. Like there's always an option, right? That a business can buy a parcel of land and build a building. If the business is able to do that, right? And maybe that is something the doctor can talk about, but like to Monica's point, like businesses do that. You know, we see that all the time. The difference is like if I guess just from a cursory glance, but like the difference is if you do this program and you do the recapture, the town gets something for it. If you don't, you don't. But there is traditional lending routes that businesses can do, which they might be able to do, might not, but I would let the doctor talk about that. So
So first of all, I know what the appraisal of the land is. That's number one. Number two, buying land and building. Sure, I don't know what the appraisal of the land is. Buying land and building a building are two different things. So we can just sit on the land, and it does no one any benefit. Or we can have a partnership where we loan the money from you. You recapture a significant portion of money via grant, and we pay you back over time in a way that we stay afloat. The density question is a little bit mind-boggling. Density of patients do not exist in this region, obviously. The density exists because we go out to different regions and collect those patients. Yeah, period. So I'm not really sure what the confusion is. It's not all of a sudden that Shoshone will have 20,000 people living here. It's not going to happen, at least not anytime soon. If it happens, wonderful, okay? Means something great is happening. But what we did is collect them from Lander, Thermopolis, Worland, Cody, Du Bois, Shoshone, Riverton. That's us doing the work. We've already established that work. What we have a tough time doing is meeting the needs of the people we already established. Because when you're in the windshield, that's time you're not seeing patients, right? If I save an hour drive, I see 4 to 5 patients potentially. And prevent people from having a deleterious consequence from underlying disease that nobody is diagnosed correctly. That's huge. If I have a center where people know I can get care. Obviously, Joel knows the region. He's from Wyoming. He never even heard of our practice. And ironically, he wound up with people that we keep afloat because we sustain the call coverage at Wyoming Medical Center. They can't even do that. Okay. With guys like Dr. Edenhoff, Dr. Wicks, myself, Dr. Flucher, and Dr. Pickle. So that's kind of the way I view things. If you want us to just do a shuttle service, that's not in our interest. That's not in anyone's interest. The interest is to make partnerships with the community that shuttle service makes sense. So my partnership is with Banner to help us, to help Shoshone and the surrounding regions. In and of itself, I'm not in the shuttle business. I'm in the cardiology business. Okay. That's what I do.
I can explain the density a little bit better. So Fremont County is roughly 9,000 plus or minus square miles and 40 something thousand people. Average density is about 4.3 people per square mile. We have more freaking cows than we do people. So that's the density that we're talking about. The density that we're talking about here is a different type of density because you're having a place where people come into and congregate and increase the density for that from various areas. So there's two different aspects of that. So it's kind of a, I would say, I won't say disingenuous. I would say it's conflating two different aspects of ways of looking at density. I just want to be clear that one is the density of the population. Yeah, we're sparsely populated, but when you bring, like, you go to Denver, it's people come to Denver. It becomes populated. Density increases. Go to a football game, the density increases downtown. When the football game is not going down there, what's the density of the stadium? Some workers. When the football game is going on, you have a high density of people. Same type thing as people coming in. That's the difference between the two densities. I just want to clarify that because I know that was a question on what density is. Two different aspects to that.
Sort of the big picture, if when this is built, it's gonna uplift the whole community. It's gonna uplift the appearance, the looks. People are gonna associate Wyoming cardiopulmonary with Shoshoni. It'll bring in more people. Potentially, we sell more lots. We have more water meters to hook up, more money to, more people move here. It costs us about the same amount of money to supply water for 600 people as it does 1,000. I mean, it's it'd be a win-win, as Dr. Idlechek said. It'd be a win-win for Wyoming cardiopulmonary, for our whole region, not just Shoshoni. Riverton, Lander, Thermopolis, it's a win for them also. Even as far as Cody, I mean, this is a good thing, and the state is really would like to see this regionalization of what Dr. Idlechek is proposing, and I'm glad the experts have explained it way better than I ever could or did. I'm glad they've come in and brought that. Any more questions?
I have one, Dr. Idlechek. Have you looked at potential, I know you don't know the appraisal of the property, but have you looked at, for some cases, Wyoming Governance Council doesn't support this? Have you looked at, or even if they do, have you looked at external funding to kind of, I guess, if you will, take the traditional route?
Well, so traditional route we looked at, and we kind of collectively say that's going to be very difficult for us to sustain. Because like a lot of, well, unlike a lot of businesses, we have no control of what people will pay us. Right? One day it's X, next year it's Y. It's the same thing. So we have to remain solvent, right? We can't disappear. We have a commitment to the people.
Yeah,
We are, thank God, financially in a position where we can help offset a lot of costs. But we can't put ourselves in a financial bind as well. We'd rather invest the resources that we can have access to by bringing other specialty groups, well, cardiology, specific specialties such as electrophysiology for the region.
Yeah, I just was curious if you had explored that avenue.
We explored it to a certain extent, and we're, trying to look at this route because I think it benefits us financially the best. And also I think it helps the town in a way we can't if we just purchase it. And again, for us, even if we purchase it, again, I don't know what the appraised cost is. The building still has a cost to it, which right now we cannot put out that cash. So we're incapable.
I don't think that piece of property would have to be, if there was a benefit to the town. I mean, we've sold other properties that have a prolonged benefit that have been fairly inexpensive.
But, we looked at that, Dr. Idlechek, they looked at that initially for, looked like that
wouldn't be the feasible way to go. But with the combination grant loan and the recapture on the,
I understand.
would be, I think
Yeah,
it'd
so
be
I
very
mean, just-
beneficial for the town.
Just think, we're gonna have to, in order to support the staff. It's gonna be between $500 to $750,000 a year. Right? Just, that's not loaned, that's money we have to generate. Right? Or have access to. The equipment inside the facility, right? The computers, the desks, the IT, everything else.
I get all that. I just was curious as to, the other route piece of you just buying it and essentially the town selling it at a win for you still, you know what I mean?
Potentially, I mean, that's something we can re-explore.
Not to
but-
cut you out, Patrick. But
Yeah, no, but I think we'd still need Patrick's support regardless.
But it's the interest rates.
Yeah, the interest rates obviously are unfavorable, right? It's unfortunate, but we had, we printed more than we actually create. And moreover, kind of looking at it, that if we want to create this, we'll need Patrick's help regardless. Right?
fair enough. I just was asking if you
Yeah.
tried to explore that avenue,
Sure.
what it was for you.
I think the other big part of that too, for or against whatever, but I think the big part of it too is the traditional sense, the construction loan, you're paying the interest the entire time for a year and a half. This way, no payment's going to be due until the project's complete, ready to go, and then the payments begin. If I understand it correctly.
So how it works, so on I think we talked about that, the grant portion, so you'd have drawdowns that you'd have to do. So essentially you spend money, you get reimbursed by the state of Wyoming for the grant piece. The
Right.
loan piece, you get that money and you just draw off of that.
But as far as
They're concerned, that's your agreement with them, right? And so
Right.
however you structure that.
but we're not.
Are you able to
We're not.
use the loan
Yeah.
to get your drawdown on the
Yep.
grant?
Yes. Yeah, because most people aren't,
Yep.
most towns aren't sitting with a huge reserve.
Right. And I was just trying to clarify, just factual,
Right.
and I want,
Yeah.
people take it how they want, but I just would rather be factual information that we're talking about.
You have a question, young lady?
I wondered if you and your staff were gonna travel every day, or how are you gonna get the needs of you and your staff as far as where to stay, what to eat?
Well, my wife wants me home, right? So I'm not,
So you're gonna be traveling
of
every day?
course, yeah. We will probably have a pull-out couch in case it snows, right? We
Sounds
can't
so
get
weird.
out.
You
We haven't had it.
Shoshoni with an I means land a little snow in the native.
Really? I didn't know that. Well, it's funny, it's since the practice has been in existence since 1978, we got snowed in once. Which is kind of interesting, right? And it was actually a group that went to Thermopolis. They got stuck there. So the idea would be during the construction phase, which would be about a year or so, we would start looking for recruitment here. The physicians would travel, the nurse practitioners would travel, unless we recruit someone during that time who approaches us saying, we would like to be part of your practice and be stationed here. Okay. So we would try to hire, train, at least if during that time frame, front desk, checkout, medical assistant, hopefully a nurse. We would really love to have a nurse from the community. Because I think it's just kind of also closer ties and familiarity. I think it's a very positive thing. Yeah, and everything else that can come along with that, we'd say, the physicians would be driving, because that's where we live. There may be guys who don't care, their wives don't care to see them. They'll bring a backpack and they'll stay there, right? I don't think we didn't put a shower in or anything, so I don't know, but we'll see. But yes, we'd be driving back and forth. But, that part, that windshield time, it's, should be an hour and a half. It's usually hour-ish, plus or minus 20 minutes. And then you get here and you just start seeing patients, basically, especially if we have the MA here. They can already open the doors with the nurse, start getting people ready and checked in. Then we just start working immediately. You know? Moreover, they can call us if there's things they need to be concerned about, etc. But the idea is that things that we're doing in Casper, we're doing here. Outside of acute care.
Anybody else have any questions? Councilman Stanley.
Thank you. I think one thing that we gotta keep in mind, that this is by far the best thing that's come along that would beautify the center of town. I mean, it's a really great opportunity to help our town grow. And this business is not a fly-by-night outfit. It's been there since 1978, and they've went through all their figures. They know exactly what they can. They know pretty much what they can and can't do. They've gone through their, you're not just heck with caution, you've not going into it very eyes away. And we're also losing the fact that the the business council is gonna review it, and if they think it's financially unviable, I mean, it's gonna get killed. You got the SLIB is going through it. If they think it's not a viable financial solution, they're gonna kill it. There's a whole lot of safeties, although there's a lot of concerns been raised and very viable concerns. I think it's important that we keep in mind that there's all these safety nets that are in place already. And that we just need to kind of work through things and see how it falls too. I mean, it's the best idea that we've had for that corner. We tried to sell it 5 years ago or do a economic development. There's all these different, nothing's working out. This would be a great thing for the town. As long as we can do it safely and fiscally responsible, but Patrick's here saying, hey, so if heaven forbid they do, and you're right, if you would be bought out if you couldn't make it. Just like that. I had a friend, he got canned from his job. So he started his own business. Within 3 months, he'd had 3 offers to buy his business that he just started for an exorbitant rate because of his Rolodex. And it's the same deal. I mean, heaven forbid, we're not financially soluble, I think is the word you use. You'd be bought out in a day just for your clientele.
We get approached.
So
My job is to keep us independent.
there is some risk. Mostly of the risk is for Wyoming cardiopulmonary, really.
Yes.
Let's be honest, but there is risk, but there's all these safety nets in place. It's not just a willy-nilly thing. It's well thought out with a lot of checks and balances through the state as well.
I think the town equally has as much risk as they do, because if we don't stay up on our reporting, it ruins our future with the business council.
Not that so much as a risk as a duty.
Yeah.
I mean, filling out
It's just
paperwork
like
isn't a risk. It's whether you do or don't isn't a risk. It's laziness or.
It's just like if you had a federal grant, you gotta do the same thing.
Right. Yeah, but I got like 6 folders in there about that thick each. I might be seeing the cardiologist here soon. I keep in mind.
Just let me know when.
Just wait a year until we have them.
Yeah.
Hope it's not Friday.
Oh, we work Friday, we work Saturday, Sunday,
No, I mean
holidays.
here.
Well, here again, we have to establish it. Businesses, it's like, you can have a great dream, right? No, but I think it's a joke, but it's a valid point. We want this to be successful.
Right.
We want it successful for the community. It's not, like I said, we can just do what we want. We don't think we're providing the best care we can by doing that. That's number one. We want to utilize the resources we have most efficiently and provide the care we expect for this entire region. And the best way to do that is to have us have a basically standalone clinic that provides what we do in Casper. And once we can make sure we have the patient flow for 4 days, it's not a discussion. It's from a business standpoint and a care standpoint. Let's go to 4.5. If we can do 5, and there's someone willing to do that, my wife would kill me because she barely sees me as is. We will do it because it's the best thing for everyone involved. And that's the whole point. We're not looking at this, you know, kind of, we're building this and we're like saying, oh, you know, this is, you know, like Hoskinson. We'll see what happens. We know what's gonna happen. We know we can do already. We want that to grow. And by growing it, that means we're taking care of more people. And we expect that to happen. Okay. And then our responsibility has to increase to those people. And that means time. And we're willing to do that.
I appreciate that. Any councilman, are you getting next to the podium or?
No, I just wanted to hear.
Okay,
Oh, sorry.
is there
I
anybody,
should have like my own microphone.
anybody else?
So first of all, I want to apologize to the doctor from earlier and the council and everybody in this room. I was out of line. But I'm also looking at the citizens of our community, and these are things that they've had addressed to me on, some are against it and some are for it. So I'm speaking for myself and our community. Thank you.
No. Thank you.
Thank you, Jennifer.
On behalf of the Chamber of Commerce, I'd like to thank Patrick and Dr. Heidelbeck for coming and explaining a lot of this to us. I have a lot clearer understanding of what's going on now. I had some questions, but they've all been answered. So thank you for coming.
Thank you.
Would you like to say anything in closing before we?
Sure. I just want to say thank you for everybody that showed up. It's important that the community cares about these kind of things because all the communities that we live in, that's home to us, right? And when you have changes coming to your home, you know, it matters. So thank you for showing up. Thank you for listening and also for bringing forward good, hard questions, because these are things that as a community you should be asking and getting information on, because it does matter. So I just want to say thank you from the state level for being involved, because we would love to see more people at these kind of meetings because it is important. So thank you very much.
Agreed.
Dr. Heidelbeck, yeah. Anything in closing?
Yeah, just dovetailing. I appreciate the questions and the interest. I really want you to realize that we're not going into this for any other reason outside of thinking this is a beneficial partnership and ultimately to provide the best care we can for our patients and hopefully future patients. Access is a key thing. And unfortunately, I don't really understand the plan behind the One Big Beautiful Bill with regards to rural healthcare. Nothing they provided really improves access. Access is logistics, and logistics is having access to the physician ultimately. And we really think by doing this, we can not only provide cardiology care, which is the foundation, but hopefully future care as well, by helping lead other practices here. And again, we're not here to compete against Sage West. We're not here to compete against River Peak. This is not competition for them. They do something we don't provide, right? They're a hospital. We're here to help take care of patients that show up there if they need outpatient care. If things in the future grow to the point where they want us to help see patients there, we will, because that's a commitment to the community. Okay, so just thank you again for your time. Okay.
I don't know if anybody in our entire town is in favor of Sage West.
Yeah.
No, listen, you know, but here's the thing. You may not like them, and you listen, we have concerns. We have concerns with a lot of facilities, but we have to have a partnership to take care of those patients because we want them to then call us if they have questions. Yeah. And we want them to send them to us if they need care.
I was just trying to make light of the situation.
Yeah, no, but you're right. Listen, I wish Sage West was different, honestly. In this competition between River Peak and Sage West that will happen, there's only so much talent. So many people that want to live here. And the question is, do you start diluting the access to care that people will have? Right? So say specialty X goes to River Peak, specialty Y stays at Sage West. People are going to be shuffled around, confused where to go. If neither of them are providing quality of care, then what happens? right? You're kind of back to the same thing. You know, it's kind of, I'm all for kind of free market, do what's best, et cetera. And the other thing people aren't realizing, the parent company of Sage West will now invest in Sage West. Right? So they're gonna allow them to spend their money, and then they're gonna start spending. So do they then compromise now this new facility? Right? It's, we'll see how it pans out. Our job is to take care of patients that need our help from either place. Yeah. So thank you.
I'd like to thank everybody that came here tonight. Appreciate all a lot of good things I think was aired out. Glad I had the professionals here to answer them because they did a great job, I think. I'd entertain a motion to adjourn this special meeting.
I'll make the motion.
Been moved by Councilman Harkey. Can I have a second by Councilman Nordine? Any further discussion? Going once, going twice. No discussion. No discussion. All in favor to adjourn this meeting at 9:38. Say aye. Aye. Opposed the same. Motion passed all in the affirmative. Thank you.